All right, everyone get ready, because today we're diving deep into the world of labor and delivery.
Buckle up.
That's right.
We're going to be looking at a document called PESP Instructor Skill Station Sheets.
Ooh.
It sounds a little dry, I know,
Okay.
but it's basically like a crash course in what paramedics need to know to deliver babies safely when they're not in a hospital.
That's right. Think labor and delivery 101.
Exactly, but with a little bit of an adrenaline rush.
Yeah, for sure.
Mm.
So imagine this scenario. You're a paramedic, you arrive on scene,
Oh boy.
and you find a patient in labor.
Okay.
What's the first thing you do?
Well, the first thing you do is not freak out.
Okay, good.
You take a deep breath and you do a thorough patient assessment. And this is way more than just checking their pulse or blood pressure. It's labor and delivery specific.
Right, because there's way more going on than in a typical medical emergency.
Absolutely. So first things first, you've got to figure out when this baby is due.
Okay?
And if the mom doesn't know the due date off the top of her head,
Could that happen?
absolutely, then they have to do a little bit of quick math.
Okay.
They add 9 months plus 1 week from the last menstrual period.
Oh, wow. So paramedics are like calendar wizards, too.
Right.
That's amazing.
It's all about gathering information quickly so they can figure out what's going on.
Right.
Now, at the same time that they're doing that, they're also looking for any potential problems. Things like high blood pressure,
Okay.
any underlying diseases or conditions, or if the baby is not in the right position.
Oh.
They're just trying to figure out, is there anything that's going to make this delivery more complicated than usual?
So they're playing detective and midwife all at once.
That's right. And then they check for the usual signs of labor, right?
Okay.
Abdominal pain,
Mm-hmm.
contractions,
Yep.
vaginal discharge.
Okay. What kind of vaginal discharge are we talking about here?
Well, it could be blood,
Okay.
often a sign that the cervix is changing,
Yeah.
or it could be amniotic fluid, the water breaking.
Okay.
They're taking all this information in, and then they want to get a good picture of her OB history.
So they're asking about any past pregnancies.
Absolutely. Any births that she's had, any complications, like if she's had a C-section before, even how long her labor was with previous babies.
So it's not just about this delivery. It's understanding the whole picture of her history.
You got it. And then comes the hands-on part of the assessment. They'll actually check how high the uterus is sitting,
Oh.
which can give them an idea of roughly how far along the pregnancy is. And they'll feel her contractions to see how frequent and how long and how strong they are.
Wait a minute. Hold on. How do you measure the strength of a contraction just by feeling?
I know, it's pretty amazing.
Yeah.
It's a skill. They can actually feel how tight the uterus is getting at the peak of each contraction to get an idea of how strong it is.
So they're like human contraction detectors.
Exactly.
That's amazing.
Yeah.
Is that it for the exam?
Almost. One more important thing.
Okay.
They have to actually visually check the perineum. So the area between the vagina and the anus.
Okay. I'm guessing there's a really good reason for that, even though it sounds a little awkward.
Right. Well, it's all about safety.
Okay.
They want to make sure that the umbilical cord hasn't slipped down ahead of the baby. That's called a cord prolapse, and that can be very dangerous.
Okay.
They also want to see if birth is imminent. Is this baby about to come out?
Right. So they're really gathering all these pieces of information, trying to put together the puzzle of what's going on.
Right, exactly. And once they have a pretty good picture of what's happening, they can start preparing for the actual delivery.
Okay, I am on the edge of my seat already.
I know, it gets exciting, right? The document goes into detail about how to prepare for a field delivery. And it's fascinating because it's this blend of medical expertise and just good old-fashioned patient care.
Right, because you want to make sure the mom feels comfortable and safe,
Absolutely.
even if she's giving birth on the side of the road or something.
Exactly. Privacy and reassurance are really, really important.
Yeah. I can only imagine how stressful and overwhelming that situation would be. A little kindness probably goes a long way.
Absolutely. Paramedics are trained to make the environment as supportive as possible, both physically and emotionally.
Okay.
Now, ideally, they want to position the mom on her back with her head and shoulders raised and her legs bent and spread apart. This helps to make sure the perineum is visible.
Okay, that makes sense.
Yeah.
But what if, for whatever reason, the mom can't get into that position?
They're flexible.
Oh.
They will adapt to the situation.
Okay.
The priority is making sure everything is safe for delivery and easy to access, while also respecting the mom's needs as much as possible.
Right, so it's not just about following the textbook every single time.
Exactly.
They have to make judgment calls in the moment.
That's right. And while they're doing all this, they're also setting up a clean environment. Sterile drapes, Lots of hand washing, gloves.
Oh, yeah.
They don't mess around when it comes to infection control.
Right, of course.
And while they're doing all that, they're also preparing for the newborn. Blankets ready to dry and wrap the baby, and extra blankets to make sure the little one stays warm.
Okay, I love that. It's so sweet.
It's easy to forget sometimes, amidst all the medical stuff, that there's this new little human about to enter the world.
Yeah.
And paramedics really do play this caregiver role. They're not just technicians, they're taking care of people. And they even follow strict protocols for handling bodily fluids and making sure the placenta is disposed of properly.
Right. So even in the middle of what could be a chaotic moment, they have a system in place to make sure everything is the right way.
That's right. But sometimes, even with the best preparation, things don't go according to plan.
Yeah, what kind of things are we talking about?
Well, one fairly common complication is called a nuptial cord.
Oh, no. What is that?
That's when the umbilical cord gets wrapped around the baby's neck.
Oh, that sounds terrifying. How
Ugh.
often does that happen?
It's actually a lot more common than you might think.
Huh.
About 25% of births.
Wow, I had no idea. Okay, so what happens if they encounter a nuptial cord during a delivery?
Well, it's all about balancing speed and caution. Okay.
Once the baby's head is born, the paramedic is going to feel for the cord. But they don't want to clamp and cut it too soon because the baby is still getting oxygen through that cord.
So they're kind of in a holding pattern, waiting to see what happens next.
Yeah, in a way, yes. The best case scenario is as the baby's body comes out, they can kind of gently slip the cord over the head or the shoulders.
Okay.
But if the cord is too tight, they might have to try something else. They might try a maneuver called somersaulting the baby.
Wait a minute, somersaulting the baby. I'm a little nervous now. I know, it sounds kind of crazy, right?
Yeah.
I'm not even sure I can picture what that looks like. Maybe it's like a gentle twist.
Yeah, I guess we'll have to use our imaginations for that one.
Hmm.
What happens if the cord is just too tight for even that maneuver?
In that case, as a last resort, they would clamp and cut the cord,
Okay.
very carefully unwind it from the baby's neck, and then deliver the rest of the baby.
Wow, that sounds pretty intense. I'm glad that paramedics know what to do in those situations.
Me too. It really shows you how important their skills are.
Yeah.
And their ability to think quickly. And that's just one example of all the things that can happen.
Right. What other kinds of challenges might a paramedic face during a field delivery?
Well, the document mentions some pretty serious medical conditions that can come up.
Like what?
Things like preeclampsia,
Right.
preterm birth,
Hmm.
and sometimes labor just doesn't progress as it should.
Wow, okay, those sound pretty heavy. Let's break those down one by one. First up, preeclampsia. What is that?
Preeclampsia is basically when a pregnant woman develops high blood pressure after 20 weeks of gestation.
Okay,
So we're talking a blood pressure reading higher than a 140/90.
okay.
And in severe cases, it can even go up to 160/110.
Now, I thought some blood pressure fluctuations during pregnancy were normal.
Hmm.
Is high blood pressure really that dangerous?
It can be tricky, right?
Yeah.
But those numbers are a big red flag.
Huh.
And it's not just about the blood pressure reading, it's also other symptoms.
Okay.
Swelling, bad headaches,
Mm-hmm.
vision problems, abdominal pain, nausea, vomiting.
That sounds awful.
Yeah, it's not a good situation. And it can have serious consequences.
Like what?
Well, the placenta can actually detach from the uterus.
Oh.
That's called placental abruption.
Okay.
And that can be life-threatening for both mom and baby.
Wow. Okay, so preeclampsia is definitely something to take very seriously.
Absolutely.
What about preterm birth? What makes that so challenging?
Well, preterm birth is any birth that happens before 37 weeks of gestation.
Okay.
And here's the scary part. It's the leading cause of death in newborns.
Really? Wow, I had no idea.
Yeah, so you can imagine if a paramedic encounters a woman in preterm labor,
Yeah.
they're getting her to the hospital as fast as possible.
Right. Every minute counts in that situation.
Absolutely. And then there's lack of progress in labor. That can happen for a bunch of reasons.
Give me some examples.
Well, the document talks specifically about two different scenarios. One is with first-time moms. They call them premip.
Okay.
Their labors tend to be a little bit longer on average. And if the baby isn't visible in the birth canal yet, then usually they prioritize getting her to the hospital.
Okay, so better safe than, get to a more controlled environment.
Exactly. The other scenario they talk about is what's called an occipito-posterior baby, or OP baby.
Okay, that sounds complicated.
It just means the baby is head down.
Okay, good.
But instead of facing the mother's back, the baby's facing her front.
Oh, so it's kind of like the baby is doing a headstand.
Kind of, yeah.
Okay.
And that can lead to a longer and more difficult labor.
Okay.
back pain for the mom, and contractions that are strong but not actually effective.
Oh, I see. So there's probably a lot of waiting and watching in that kind of situation.
There is, yeah. They have to monitor the mom and the baby very closely,
Okay.
make sure the baby's position isn't causing
All
problems,
right.
and make judgment calls based on each individual situation.
That's really amazing. They have to think on their feet and adapt to whatever's happening.
Exactly. And sometimes they have to deal with even more serious complications, like hemorrhage, which is basically just excessive bleeding.
Oh, now we're getting into scary territory.
Yeah, hemorrhage is a big deal.
Yeah.
The document differentiates between two types: antepartum, which is bleeding that happens after 20 weeks of pregnancy,
Okay.
but before labor starts, and then intrapartum, which is bleeding that happens during labor.
Okay. So what causes these hemorrhages?
Well, two of the main culprits are actually ones we've already talked about: placenta previa
Right.
and placental abruption.
Okay. I'm going to need a reminder. What are those again?
Placenta previa is when the placenta is either partially or totally covering the cervix.
Okay.
And placental abruption is when the placenta detaches from the wall of the uterus too early.
Right. Those both sound very dangerous. I can see why bleeding would be a major concern.
Absolutely. It's a life-threatening situation. They need to
Mhm.
get mom and baby to the hospital right away.
So we've talked about a lot of different complications. Are there any other tricky scenarios that paramedics need to be prepared for?
One more.
Okay.
Meconium.
What is that?
It's basically baby's first poop.
Okay. Why is that a problem?
Well, while the baby is still inside the womb, meconium is sterile. But if it starts showing up in the amniotic fluid, it can be a sign that the baby's in distress.
Okay, so it's like a warning sign that something might be wrong.
Exactly. And there's a chance that the baby could inhale meconium during delivery.
All right.
And that can lead to a serious condition called meconium aspiration syndrome, or MAS.
Oh, gosh. Okay, so what do they do if they encounter meconium?
Well, they have procedures based on the 2017 Neonatal Resuscitation Program guidelines.
Okay.
And it's interesting because they no longer recommend routine intubation and suctioning in those cases. Instead, they focus on drying and stimulating the baby,
Oh,
making sure they stay warm, positioning their airway correctly, and giving them positive pressure ventilation if they need it.
so it's a little bit more of a gentle approach,
Yeah.
focusing on the baby's overall well-being,
Exactly.
but they still have to be prepared to take more serious measures if the baby's not breathing.
Yeah. Oh, yeah, absolutely. If the baby's not breathing or the heart rate is too low, they jump into full resuscitation mode.
It's amazing how much paramedics know
It is, yeah.
about all things babies.
It really is.
They're like miracle workers out there in the field.
Absolutely. It's not just about knowing the steps, though. It's
Wow.
about being able to assess the situation
Yeah.
and figure out what each individual mom and baby needs.
So they really are balancing a lot,
They are, yeah.
using both their knowledge and their intuition to make the best decisions.
Absolutely.
I have learned so much in just this short amount of time.
Yeah.
I can't believe how much information is packed into what seemed like a really straightforward document.
Yeah, it really makes you appreciate how complicated childbirth can be.
Absolutely. And how much expertise it takes to handle all the different situations that might come up.
It does.
I am definitely leaving labor and delivery to the professionals.
Same here. But if anyone out there is curious to learn more, I definitely recommend checking out those 2017 Neonatal Resuscitation Program guidelines.
Yeah, that's a great resource.
It's fascinating.
It really is. Well, thanks for joining us on this deep dive into labor and delivery from a paramedic's perspective.
My pleasure.
It's been quite a ride.
It has been. You know, we've been talking about all these really intense scenarios and situations.
Yeah.
It makes you realize that paramedics
Yeah.
really have to be masters of multitasking.
Oh, for sure.
Yeah.
It's like they're juggling a million things at once.
Right.
They're assessing the mom, they're monitoring the baby,
Yeah.
they're prepping for delivery,
Mm-hmm.
and somehow they're supposed to stay calm and collected through all of that.
It's true. They have a lot on their plate, especially in these high-pressure situations.
Yeah.
And, you know, one thing that this document really emphasizes
Yeah.
is the importance of having clear protocols and guidelines
Right.
to help them navigate these tricky situations.
Yeah, like those 2017 Neonatal Resuscitation Program guidelines you mentioned before.
Right.
It sounds like having those steps laid out is crucial when you're dealing with a newborn who might need help right away.
It really is. They provide a roadmap for decision-making
Okay.
and make sure that everyone's on the same page in delivering consistent care.
Yeah, that makes sense.
It's remarkable how this document blends the practical aspects of childbirth with the clinical knowledge.
Yeah.
Like, they have to have both, right?
Yeah, it's like this balancing act between
Yeah.
being a skilled technician
Yeah. Yeah.
and a compassionate caregiver.
Exactly. And they
Well,
need both of those things to be effective.
absolutely.
Yeah.
One thing that stuck with me from part one was how much emphasis they put on creating a calm and reassuring environment for the mom.
Right.
I can imagine that can be pretty tough,
It is.
especially when there are complications.
Absolutely.
Yeah.
That's where communication skills and the ability to build trust with the patient are so important.
Okay.
They have to be able to explain what's going on in a way that makes sense,
Right.
answer any questions honestly and clearly,
Yeah.
and just provide support during a really vulnerable time.
Yeah, I was going to say, it's almost like they have to be part therapist,
Uh-huh.
part medical professional.
No, in a way, yeah. They're addressing the emotional needs
Right.
as well as the physical needs.
Exactly. And speaking of addressing needs, this document also talks about infection control,
Yes,
which is another really critical part of their work.
it is.
We talked about the sterile drapes and the hand washing
Uh-huh.
and wearing gloves during the delivery prep.
Yeah.
But what about after the baby's born?
Right.
All the stuff.
Yeah, what happens to all that?
What happens to all that?
It's a good question. And it's something they address very specifically.
Okay.
They talk about the importance of universal precautions,
Okay.
which basically means treating all bodily fluids as potentially infectious.
Right. So you're not just going to like casually toss the placenta in a trash can.
No, definitely not.
Right.
They have specific protocols for bagging and disposing of the placenta
Okay.
and any other materials that could pose a risk.
It's all about safety,
Yeah,
right?
exactly.
Keeping everyone safe.
Keeping everyone safe.
It's amazing how much thought and care goes into every step of this process.
It really is. Reading this document has really got me thinking about just how much paramedics know
Yeah,
and all the different things they have to be prepared for.
absolutely.
I mean, we've talked about some intense scenarios,
Yeah.
but there's so much more to it than that.
Right.
And the fact that they can juggle all of that
Yeah,
and still provide compassionate care is really amazing.
totally. They have to be ready for anything and everything.
Right.
And it's not just about following a checklist.
Yeah.
It's about thinking on their feet and adapting to unexpected situations.
It's like they're making life or death decisions right there on the spot.
It's true. And they're doing it all the time.
Yeah, like we were talking about preeclampsia and preterm birth,
Mm-hmm.
hemorrhage. Those are serious situations.
Yeah, and they can change really quickly.
Right. And even things that might seem less critical,
Yeah.
like a neutral cord or meconium in the amniotic fluid,
Right.
those can turn into emergencies very quickly.
Hmm.
Absolutely. So they're always assessing, always looking for clues,
Yeah.
and ready to switch gears if they need to.
It's amazing. This whole conversation has really given me like a whole other level of respect for paramedics.
I hear you. It's easy to take their skills for granted
Yeah.
until you really understand what all goes into their job.
Absolutely. They are truly everyday heroes out there,
They are.
working behind the scenes to keep our community safe.
They are.
And so, as we wrap up this part of our deep dive, what's like the one key takeaway
Okay.
you want our listeners to walk away with?
I think the main thing to remember is that childbirth,
Yeah.
while it's a natural and beautiful process, can also be unpredictable
Yeah.
and potentially dangerous.
Right.
And that's why it's so important to have highly trained professionals like paramedics
Yeah.
who are ready to step in when it's needed.
And provide expert care.
Exactly. They are the unsung heroes of labor and delivery.
I love that.
Right.
The unsung heroes.
They really are.
And so for anyone listening who is pregnant or maybe planning to become pregnant, always a good idea to talk to your doctor
Absolutely.
and follow their advice
Yes.
for a safe and healthy pregnancy and delivery.
Good advice. And if you ever find yourself in a situation
Yeah.
where you need emergency help during labor,
Right.
don't hesitate to call 911.
Right. They're there to help 24/7,
They are.
365 days a year.
Absolutely. Ready for anything.
Exactly. From
Yeah.
routine deliveries to the most complicated cases.
That's right.
So let's give a big virtual round of applause to all those paramedics out there.
Yes.
You truly make a world of difference.
Here, here.
All right, well, get ready for part 3 because we're going to explore even more about this amazing world of paramedics and childbirth. This document is incredible.
It is, isn't it?
It's been realized how much paramedics need to know.
Oh, yeah.
It's not just about like delivering a baby.
Right.
It's about thinking ahead.
Right.
What could go wrong?
Mhm.
Making decisions quickly and being able to adapt.
Yeah, being flexible.
Yeah.
That's key.
to all kinds of crazy situations.
Absolutely. They're like walking medical encyclopedias,
Right.
but with like a
Yeah.
superhuman level of calmness.
Right?
I mean, think about all the stuff we've talked about.
Yeah.
And there's even more.
Oh, I know.
This document even gets into the specifics of neonatal care.
Right. There's specialized care for newborns.
Yeah.
That's right. And in part one, we touched on the 2017 Neonatal Resuscitation Program guidelines. And it seems like having those clear procedures
Yeah.
is really crucial,
Oh, absolutely.
especially when you're dealing with a newborn who needs help right away.
You've got to have that roadmap for
Yeah.
decision making.
Right. Like a step-by-step.
Yeah, exactly.
So you know exactly what to do.
Right, and everyone's on the same page.
Yes. Consistent care.
And it's amazing how this document blends together those practical, hands-on things with all that medical knowledge.
Right. It's like they need to have it all.
They really do. The practical and the knowledge.
Yeah. And I think that's what makes their work so amazing.
Yeah.
It's just incredible how they can handle these really intense situations, life or death,
Yeah,
bringing new life into the world.
absolutely.
And they do it with so much expertise.
I know, it's inspiring.
It really is.
Yeah.
I mean, listening to you talk about all this,
Yeah.
it's like paramedics are kind of like real-life superheroes,
I love that analogy.
right? They just show up.
They do.
They assess the situation.
Yeah.
They use all their knowledge and their skills.
Yeah.
And they save the day.
It's true.
Yeah. And this document gives us a little peek
It does.
behind the curtain
Yeah.
at all that knowledge that they have
Yeah.
and that they use every day.
Yeah. It's pretty amazing.
This deep dive has been so interesting.
It has.
I've always have a lot of respect for paramedics, but now I just have this whole new level of appreciation
Me too.
for how complicated their job really is.
It's easy to underestimate them
It is.
until you really get into the weeds
Right.
of what they do.
Of everything that they do.
Yeah.
And on that note, I think it's time for us to wrap up this episode.
Okay, I think we've covered a lot of ground.
Yeah, we have.
We have.
We've learned so much about labor and delivery and how, although it's a natural process,
Yeah.
it can also be pretty unpredictable.
It can.
Right. And we've seen how paramedics play this crucial role
Yeah, they do.
in making sure that both the mother and baby are safe,
Yeah.
even when things get really challenging.
Absolutely.
And for anybody who's out there listening who wants to learn more,
Yeah.
definitely check out those 2017 Neonatal Resuscitation Program guidelines.
Oh, they're so fascinating.
They really are.
It's a great resource.
And for any expectant parents out there,
Yeah.
remember to consult with your healthcare provider
Always good advice.
to get personalized guidance
Yeah.
and support throughout your pregnancy.
Absolutely. Pregnancy's a journey.
It is.
Lots of questions come up.
Yeah.
So definitely reach out to your provider.
Yeah. And never hesitate to seek medical attention
Right.
if you have any concerns
Yeah, if anything feels off.
or any complications come up.
Absolutely.
And to all those amazing paramedics out there,
Yes.
thank you.
Thank you.
For your dedication, your expertise,
Mm-hmm.
and just your unwavering compassion.
Guys make such a difference
You really do.
in the lives of so many families.
You're the unsung heroes of the medical world.
We're so grateful for your service.
All right, that's a wrap for another deep dive.
They've had fun.
Me too. Until next time, stay curious.
Keep learning.
Keep those brains buzzing.
Okay, so today we're looking into something pretty intense, like a side of emergency medicine that most people probably never even think about.
Right.
It's all about the moments when paramedics have to deal with childbirth when they totally weren't expecting it,
Yeah, talk about pressure.
especially in cases of like denied or hidden pregnancies.
Right, exactly.
You sent me some really fascinating stuff about this.
It's a really interesting area.
It is.
It requires a lot more than just medical knowledge. We're talking about medical expertise, but also like understanding all the psychological and social factors
Right.
that come into play with these situations.
Yeah.
Delivering a baby in these circumstances, that's just one part of it.
Yeah.
The real challenge is providing that really compassionate care
Yeah.
when the situation itself is just loaded with all this emotional complexity.
Yeah. And right from the start, one of the things that just jumped out at me from the sources you sent was this statistic.
Yeah.
1 in 475 pregnancies are denied in the first 20 weeks,
Wow.
which, I mean, that's a lot more common than I would have thought.
It is.
But I think before we get too far, we should really define what we mean by denied and hidden pregnancies,
Oh, absolutely.
because I think there's a difference there.
There's a critical distinction between those two terms.
Okay.
So, a denied pregnancy, think of it like an unconscious defense mechanism
Mm-hmm.
where the person, they don't even realize they're pregnant, you know?
Oh,
It's
wow.
almost as if their mind is trying to protect them from this reality they just can't cope with.
That's wild.
Yeah.
Okay, and so then a hidden pregnancy?
A hidden pregnancy is different.
Yeah.
It's a conscious decision
So
to conceal the pregnancy from everybody else.
Gotcha. So then why might someone go to those lengths? I mean, why hide a pregnancy? What kind of factors would have even lead to that?
Oh, there's a whole range of factors. It would
Yeah.
be like a fear of judgment from, their family or friends. Or maybe they've been through some past traumas that are kind of resurfacing
Oh, wow.
that makes them want to hide it.
Yeah.
In some cases, maybe it's because they just don't have a support system.
Right.
Or maybe they're scared of what this pregnancy might mean for their life.
Yeah.
The potential consequences of it.
And I would imagine that that lack of awareness, whether it's denied or hidden, probably has some pretty serious consequences when we're talking about the health of the mother and the baby.
Oh, absolutely.
I mean, that's kind of a big deal.
Yeah, one of the major concerns is that they're not getting any prenatal care
Right.
because those regular checkups, they're not just routine,
Right.
They're vital for tracking the health of the mom and the baby.
Mm.
And without them, you see a much higher risk of things like preterm birth,
Oh,
low birth weight,
yeah.
and tragically, even infant mortality.
It's almost like, those situations where the paramedics might be the first ones to realize that there's a pregnancy at all,
Right.
let alone that, labor is already happening.
That's right.
So what a high-pressure situation for those paramedics to be in.
It really is. And that's why it's so important for them to be ready to handle these situations, not only quickly, but with a ton of sensitivity.
Right.
It's like their actions in those first few minutes,
Mm.
they can have a huge impact on the health of both the mother and the baby.
Right.
It's not just about delivering the baby.
Right.
It's about navigating this whole situation that's
Yeah.
so stressful and emotionally charged
Ab-
and doing it with the utmost care.
So let's actually walk through those first few moments.
Okay.
One of the sources you gave me goes into a lot of detail about the specific things paramedics should be looking at, when they assess the patient in these cases.
Yeah, the assessment's key.
Is there anything that's particularly tricky or unique about assessing a patient who might be in denial or hiding a pregnancy?
The big thing is just recognizing the signs.
Oh,
Because these patients, they might not say anything about their condition.
yeah.
They might not even be aware of it themselves.
Right.
So paramedics have to be incredibly sharp,
Oh, wow.
picking up on even the subtlest little hints
Yeah.
and being so sensitive in how they approach the patient.
Right.
It's like detective work, but the stakes are incredibly high.
Wow. And then, of course, you've got the whole psychological aspect of it, too.
Exactly.
Your sources mention things like depersonalization
Yeah.
and dissociation.
Uh-huh.
Can you kind of explain what those are and why they might be happening in these situations?
Sure. So imagine a patient who's saying their pain is really low.
Mm-hmm.
It's almost like they're detached from their own body.
Oh, wow.
That's what we call depersonalization.
Okay.
It's this coping mechanism that our minds use to deal with really overwhelming stress.
Interesting.
And then you've got dissociation, where the person kind of mentally checks out of
Mm-hmm.
the situation,
Right.
so they don't get completely overwhelmed.
It makes sense, but it also must make it so difficult for the paramedics to figure out what's really going on
For sure.
when the patient is having these reactions that are so unexpected.
Yeah.
So how do they even start to build trust and rapport in a situation that's so sensitive?
It all comes down to compassionate care.
Right.
One of your sources actually said it really well.
Oh, okay.
Approaching the patient with empathy, not judging them,
Right.
and creating an environment where they actually feel safe.
Uh-huh.
Safe enough to talk about what they're going through. That's crucial.
Yeah.
It's about recognizing how vulnerable they are and approaching the situation with a lot of sensitivity.
Right.
It's really important.
And then clear communication must be super important as well.
Oh, absolutely.
One of the documents that you shared actually really stressed how important it is to use simple language and to really listen.
Yeah, that active listening.
Right.
It's so key.
Mm-hmm.
Think of it like meeting the patient right where they are,
Yeah.
emotionally and mentally.
Right.
You're recognizing that this is a vulnerable person. They often have these really complex personal histories,
Right.
maybe even trauma in their past.
Mm-hmm.
And building that trust and connection in those first few minutes is just so important. to
Yeah.
being able to care for the whole person.
Right.
It's not just about the physical stuff.
Exactly.
It's about the whole person.
We've been talking a lot about the psychological side of things, but we can't forget about like the actual medical stuff that needs to happen. I mean, we're
Mhm.
still talking about a situation where a baby's being born,
Absolutely.
right there, right then.
It's easy to get caught up in all of the psychological stuff.
Yeah.
But at the end of the day,
Yeah.
paramedics have to be ready to handle an actual birth,
Right.
you know, often in some pretty crazy places.
Yeah, one of the sources you gave me actually talks about how to manage bleeding after the baby's born.
Oh, right.
And it says that it can be especially tough if the mom hasn't had any prenatal care.
That's a really important point.
Yeah.
Postpartum hemorrhage, that's what we call it,
Okay.
or excessive bleeding after childbirth, it's a serious problem.
Uh-huh.
And the source says that the most common cause is something called uterine atony. Basically, think of the uterus as a muscle.
Okay.
It needs to contract after the baby's born to stop the bleeding.
Hmm.
Uterine atony is when that muscle doesn't contract properly,
Oh,
and that can cause life-threatening blood loss.
so you're saying that it's really important to be able to tell if someone has uterine atony.
Right, and to treat it quickly.
Okay, how do they do that?
Well, the source mentions something called external uterine massage, and that's usually the first thing they try.
What does that even involve?
It's basically like a massage,
Okay.
but the paramedic is applying firm pressure to the mother's abdomen,
Oh,
specifically to the uterus,
right.
to encourage it to contract
Gotcha.
and hopefully control the bleeding.
Okay, the document also mentions something called bimanual compression, which just sounds intense.
It is a bit more invasive,
Yeah.
but it can be a lifesaver
Okay.
if the bleeding is really bad.
Mm-hmm.
Basically, the paramedic puts one hand inside the vagina
Oh, wow.
to press directly on the uterus,
Okay.
and the other hand presses on the abdomen from the outside.
So it's like
Yeah, it's a two-handed technique.
two-handed. Yeah.
It's not something they do right away,
Right.
but it's an important tool to have.
It's amazing what paramedics have to be able to do.
Yeah, it really is.
They need to know so much and be
Yeah.
able to do so many different things.
Especially in these crazy situations where anything can happen.
Right. And they don't always have a lot of time.
No, they often have to make decisions really fast
Yeah.
with whatever resources they have available.
Okay, let's switch gears a little bit
Okay.
and talk about the baby.
Yeah.
What are the most important things to do for the baby right after they're born?
Well, one of the most critical things is to keep them warm, especially if they're premature or unexpected.
Right.
Newborns are really vulnerable to temperature changes.
So I'm guessing lots of blankets.
Yeah, lots of blankets and
Yes.
skin-to-skin contact with the mother if possible.
Yeah, I was going to say, like, is skin to skin a good thing?
Oh, absolutely.
Yeah.
It's the best.
Okay.
Keeps the baby warm,
Mm.
helps regulate their breathing and heart rate.
Wow.
It's really nature's way of helping them adjust to life outside the womb.
Amazing.
Yeah.
The source also mentioned something about stabilization.
Right.
What does that mean for a newborn?
Basically, it means making sure they're transitioning well to life outside the womb.
Okay.
Paramedics check their breathing, their heart rate, their color,
Mm-hmm.
and if they need any help, like oxygen or suctioning,
Right.
they do that right away.
So it's like giving them the best possible start.
Exactly.
Okay. So we've talked about assessing the situation, the psychological factors, what to do for the mom medically, and what to do for the baby. What else haven't we talked about?
Well, we've been focusing on the immediate situation,
Right.
but it's important to remember there can be long-term impacts,
Oh, right.
especially for the mother.
Okay.
These are often women who had no idea they were pregnant,
Yeah.
or they were trying to hide it.
Right.
That can have some pretty serious emotional consequences.
Right. We talked about the potential for trauma earlier.
Yeah.
But are there any other psychological or emotional things that might come up later?
Definitely.
Like what?
Postpartum depression and anxiety
Right.
are always a concern for new mothers,
Mm-hmm.
but they can be even more common in these cases
Oh, okay.
because the birth was so sudden
Yeah.
and they were dealing with all the emotions of a hidden pregnancy.
Right.
It can be a recipe for some serious mental health challenges.
Yeah, I can see that.
There's also the potential for guilt,
Mm.
shame, maybe even resentment.
Oh, wow.
So it sounds like they really need mental health support.
Right. And not just right away, but for a while after.
You got it.
Okay.
And it's not just about the mother herself.
Right.
It's about the whole family.
Mm-hmm.
A situation like this can really shake things up for everyone.
So how do we make sure these women and their families get the support they need?
Well, it's going to take a team effort.
Okay.
Healthcare providers, social workers,
Mm.
maybe even community groups.
Right.
It's about creating a safety net.
Mm-hmm.
to address all their needs.
What kind of needs are we talking about?
Counseling,
Okay.
parenting resources,
Mm-hmm.
maybe even financial help,
Right.
whatever they need to get through this.
It sounds like it can make a huge difference.
It really can.
Okay, so we've covered a lot of ground here.
We have.
The psychological impact of denied and hidden pregnancies, the actual medical procedures, the effect on mental health, all the family dynamics.
It's a lot to unpack.
It is, but there's one more thing I think we need to talk about.
Okay.
The legal and ethical side of things.
Oh, yeah.
That's a whole other can of worms.
It is, especially when you're dealing with a patient who might not even know they're pregnant.
Right.
Or they're actively trying to hide it.
Yeah.
The usual rules get a little fuzzy.
I mean, one of the most basic things in healthcare is informed consent.
Absolutely.
But how do you get informed consent from someone who's in denial?
That's the million-dollar question.
Yeah, it seems impossible.
It's a real dilemma.
Right.
Healthcare providers have to balance respecting the patient's autonomy
Mm-hmm.
with doing what's best for them.
Even if the patient doesn't really understand what that is,
Exactly.
it's tricky.
It is.
And what about the baby?
Yeah, good point.
Does the mother's denial or hiding the pregnancy have any effect on the baby's legal rights?
Legally, that's where things get really interesting.
Okay.
Laws can be different in different places,
Mm-hmm.
but in general, a newborn's rights are seen as separate from the mother's.
So it doesn't matter what the mom is thinking or doing.
Right.
The baby still has rights.
Exactly. The law recognizes that the baby is a separate person with their own rights.
Regardless of how they were born.
Exactly.
So even if the mom doesn't want the baby or is trying to pretend it doesn't exist, the baby is still entitled to full legal protection.
Yes, and to proper medical care.
And everyone involved in the baby's care.
Right. Paramedics, doctors, nurses, they all have a legal and ethical obligation to take care of that baby.
Regardless of what the mom wants. That makes sense.
Yeah.
It brings up another question, though.
Okay.
What if the mom is using drugs or alcohol when she gives birth?
That definitely adds another layer of complexity.
How so?
Well, first, there's the immediate concern for the baby's health.
Right.
Because exposure to drugs and alcohol in the womb can be really dangerous.
Yeah.
And then there might be legal consequences for the mother.
Depending on the laws in that place.
Exactly. It's a very delicate situation.
So how do paramedics deal with that?
Well, it's about finding a balance. They need to make sure both the mom and the baby are safe.
Right.
But they also need to respect their rights and dignity.
So it sounds like clear communication is important.
Absolutely.
Not judging the mom.
Definitely.
Trying to understand where she's coming from emotionally.
Exactly. It's about recognizing that this is a very complex situation.
Yeah.
Often with a lot of underlying issues.
Right.
And emotional baggage.
Wow. This has really been an eye-opening deep dive.
Yeah, it has.
I never thought about this side of emergency medicine before.
It's not something most people think about.
It's amazing what paramedics deal with.
They're incredible.
They really are.
Think about it. They're often working in really stressful situations with very little information.
Right.
And they have to make these huge decisions.
In a matter of minutes.
Sometimes seconds.
Before we wrap things up,
Okay.
I want to leave our listeners with something to think about.
Right.
We've talked a lot about how hard these situations are for paramedics.
Right.
But what about the bigger picture?
Okay. I see where you're going.
The things in our society that might be contributing to denied and hidden pregnancies in the first place.
Oh, yeah, that's huge.
Like, what if people just don't have access to healthcare?
That's a big one.
Or what if there's a huge stigma around unplanned pregnancies?
Or fear of judgment from family and friends.
Right.
All that stuff.
Yeah, addressing those root causes is key.
It is.
If we want to actually make things better for mothers and babies.
It can't just be about responding to emergencies.
No, it's about creating a world where women feel supported and empowered.
Right.
And where they feel safe to make their own choices about their reproductive health.
Without being judged.
Exactly.
Wow, this has really made me think.
It's definitely given us all a lot to think about.
Healthcare is so much more than just treating physical problems.
You got it.
It's about seeing the whole person.
The whole person.
Their physical, mental, emotional, and social well-being.
It's all connected.
And it's about treating everyone with empathy and respect.
Absolutely.
And really wanting to help.
No matter what.
No matter how complicated things get.
That's what it's all about.
Well, thank you so much for joining us for this deep dive into the world of denied and hidden pregnancies.
It's been a pleasure.
It really has. And to everyone listening, remember, this is just the beginning.
Right.
If this has piqued your interest.
There's so much more to learn.
There is. So keep learning, keep exploring.
And keep asking questions.
We'll see you next time. All right, so get ready because today we're going to be diving deep into the world of childbirth
Oh,
complications.
yeah.
Yeah, some really interesting stuff. And we're looking at this document called 9-Wen1217.03.09 PESP Instructor Skill Station Sheets .pdf.
Okay.
It's a material that's actually intended for like first responders,
Yeah.
EMTs and paramedics and things like
Yeah,
that.
that's right.
So really fascinating stuff, even if you're not planning on delivering a baby.
Exactly. It gives you a whole new appreciation for,
Wait, what can go wrong?
yeah, exactly what can go wrong and how these guys are prepared to handle just about anything.
And I think it's easy to forget that things can go wrong, right? Because childbirth, it's a natural process. It's something that's been happening, for all of human history,
Yeah.
but it's not without its risks.
Right. And I think because it's so common and we see it in movies all the time, we just kind of assume that it's straightforward. But there are
So if it's,
definitely, yeah, there are definitely some things that can come up.
Yeah, so we're going to walk you through 3 of the major complications that are highlighted in this document, and we're going to look at, what they are, what makes them dangerous, and what these first responders actually do about it.
Sounds good.
So the 3 that we're going to look at today are malpresentation cord prolapse and postpartum hemorrhage.
Oh, right. A good mix.
Yeah, so let's start with that first one, malpresentation.
Okay.
So to kind of wrap our heads around this, think about trying to fit a puzzle piece into the wrong spot.
Mm-hmm.
It's just not going to work, is it?
Nope, not going to happen.
So, ideally when a baby's coming down the birth canal, you want that little head leading the way, right?
Absolutely. Head first, perfect fit.
Yeah.
And we call that the presentation. So the presenting part is whichever part of the baby is closest to the birth canal. Makes sense.
Ideally the head.
Now, babies don't always cooperate, do they?
Oh, they do not.
Yeah.
Sometimes they like to keep us on our toes.
So what happens when the baby is not head down? That's when we get these malpresentations, and they can be tricky. The document lists 3 main types.
Okay.
We've got transverse lie, shoulder presentation, and unstable lie.
Okay, so let's break those down a little bit.
All right, so picture the baby lying sideways across the uterus. That's your transverse lie.
Uh-huh.
Definitely not going to fit near the birth canal that way.
Yep.
Then you've got shoulder presentation, where the baby's shoulder is trying to make a grand entrance first.
Oh, boy.
And then unstable lie, that's where the baby just can't seem to settle on a position even late in the game.
Wow. So these all sound pretty problematic, but what kind of risks are we talking about here? What can actually go wrong?
So malpresentation can lead to some serious complications. For one, it ups the risk of the umbilical cord slipping down ahead of the baby,
Yeah.
which we call cord prolapse.
Uh-huh.
That's a huge emergency because that cord is the baby's lifeline.
Right.
And if it gets compressed, it can cut off the oxygen supply.
That's scary.
Another issue is something called obstructed labor, where the baby simply can't get through the birth canal because of the position.
Oh, wow. I was reading through this document, and it's amazing how observant these paramedics have to be. They're looking for like these subtle signs of malpresentation things that, most people wouldn't even think about.
Yeah, like what?
Like it mentioned a wide or asymmetrical abdomen as a possible indicator.
Oh, that's interesting.
Yeah, so they're really looking for any clues to figure out what's going on.
Yeah, they're like detectives
Right.
piecing together the puzzle.
So what happens if a paramedic actually sees a limb, like a little arm or leg coming out first? Do they try to push it back in?
No, absolutely not.
Okay.
That's actually dangerous.
Really?
Yeah, it could cause more harm than good.
Huh.
And we also want to discourage mom from pushing in those situations. It's a big no-no.
Okay.
So it's all about load and go. Get her to the hospital. ASAP.
Get to the experts.
Exactly where the doctors can safely intervene.
Speaking of load and go, I'm curious. You see in movies all the time, like the baby's coming, somebody has to deliver right there.
Yeah.
What kind of factors might make a situation so urgent that a paramedic wouldn't even attempt delivery on the scene?
That's a great question. And you've hit on one of the biggest misconceptions about childbirth.
Hmm.
While there are definitely situations where a delivery might happen outside of a hospital,
Right.
most complications require the kind of care that you just can't get in an ambulance or somebody's living room.
Right. So it's not just about speed. It's about getting mom to the appropriate level of care as quickly and safely as possible.
Exactly. And that actually leads us perfectly into our next complication, cord prolapse.
Oh, boy. This is the one that gives me the chills.
Yeah, this is a true race against time.
The document doesn't sugarcoat it either.
Yeah.
Calls it an acute obstetrical emergency.
Yeah, strong words.
So what's going on here?
So picture this, the umbilical cord, that lifeline that carries oxygen and nutrients to the baby. It slips down into the birth canal ahead of the baby. and it can actually get compressed between the baby and the mother's pelvis,
Oh.
cutting off the baby's oxygen supply.
So it's essentially a plumbing problem with potentially devastating consequences.
Yeah, that's a good way to put it.
Every second counts.
Absolutely. Now, here's something interesting. The document actually says that imminent birth with cord prolapse is pretty rare,
Oh, really?
especially for first-time mothers.
So that's slightly reassuring, I guess, but still, if it happens, you've got to know what to do.
Right, and that's where these first responders really shine. They have a specific set of actions they take to try and save the day.
Okay, so what do they do?
First, they try to reposition the mother to take the pressure off the cord.
Okay.
Imagine her on all fours leaning forward. That's the knee-chest position.
Mm-hmm.
Uses gravity to help us out.
Okay, and is that usually enough?
Sometimes, but often they need to go a step further and manually elevate the presenting part of the baby.
What does that mean?
It means gently lifting the baby off the cord. Yeah, so they might actually cradle the cord in one hand and use the other to carefully apply upward pressure on the baby.
Wow, that's delicate work under some serious pressure.
Oh, absolutely. It's incredible what they're able to do.
And all this is happening while they're prepping for transport to the hospital.
Right, it's a full-on team effort.
So they're like multitasking masters.
They have to be.
Yeah.
Communicating with the hospital, getting mom ready for transport, and manually holding that baby off the cord.
Wow, so not for the faint of heart.
Not at all.
All right, so let's move on to that final complication we're going to talk about today. And it's something that can be a little harder to talk about, postpartum hemorrhage.
Yeah, it can be a little scary, but it's important to understand.
Absolutely. So the document defines it as basically any amount of blood loss that sends the mother into shock.
Right, so we're usually talking about losing more than 500 milliliters of blood after a vaginal birth,
Okay.
which is about 2 cups.
That's a lot of blood.
It is, and the document goes on to explain that a whopping 70% of postpartum hemorrhage cases are caused by something called uterine atony.
Uterine atony.
Yeah, it's a mouthful.
Okay, so break that down for us. What is uterine atony?
So after birth, the uterus, which has been stretched out for 9 months, needs to shrink back down to its normal size.
Yeah.
And it does this by contracting, and those contractions are what clamp down on the blood vessels to prevent excessive bleeding.
Okay, so basically the uterus needs to tighten up after birth to stop the bleeding.
Exactly. And uterine atony means those muscles aren't contracting like they should be, leading to a hemorrhage.
Okay, so what do first responders do if they suspect postpartum hemorrhage?
There are 3 main things they focus on: communication, resuscitation, and identifying and treating the cause of the bleeding.
Okay, let's take those one at a time.
So first up, communication.
Yeah.
They make sure everyone is aware of what's happening, including the mother.
Right.
Then it's resuscitation,
Okay.
starting an IV, administering oxygen, monitoring vital signs.
So they're working on stabilizing her while also trying to figure out what's causing the bleeding.
Exactly. It's a 2-pronged approach.
And how do they figure out the cause of the bleeding?
They have this really clever mnemonic device
Okay.
called the 4 T's.
The 4 T's.
Yes, it stands for tone, tissue, trauma, and thrombin.
Okay, so tone, tissue, trauma, and thrombin. Break that down for us.
Okay, so the first T-tone refers to the uterus itself.
Right.
They're feeling to see if it's firm and contracted,
Uh-huh.
which is what we want,
Okay.
or if it's soft and boggy, which could indicate that uterine atony.
So they're literally checking the muscle tone.
Exactly. It's a hands-on assessment.
Okay, what about tissue?
That one's all about the placenta, making sure it's been delivered completely and that there are no pieces left behind.
Right, because we talked about how retained placental fragments can cause problems.
Exactly. They can prevent the uterus from contracting properly.
Got it. So tissue is about making sure everything that should be out is out.
Yep.
What about trauma?
Trauma refers to any injuries to the birth canal,
Okay.
like tears or lacerations that can happen during delivery.
Right.
So they'll visually inspect the area for any signs of injury.
Okay, so trauma is about looking for physical damage.
Exactly. And then the last T thrombin is a bit more complex. It's a clotting factor that's crucial for stopping bleeding.
Okay.
So in severe cases of postpartum hemorrhage, they might need to give medications that help promote clotting.
Got it. So the 4 T's help them figure out what's causing the bleeding and what needs to be done to stop it.
It's a really effective system, especially in a high-pressure situation.
It really is. Now, the document also mentions that managing postpartum hemorrhage is a little different depending on whether the placenta has been delivered or not.
That makes sense.
So let's say the placenta hasn't been delivered yet. What happens then?
Well, first of all, they absolutely avoid massaging the uterus if the placenta is still inside.
Okay.
Instead, they'll try to gently pull on the umbilical cord and encourage the mother to push during a contraction to help deliver the placenta.
Okay, so controlled cord traction.
Exactly.
What if that doesn't work?
Then it's straight to the hospital with lights and sirens.
So getting to the hospital is always the ultimate goal.
Absolutely,
Yeah.
especially with something as serious as postpartum hemorrhage.
Okay, so that's if the placenta hasn't been delivered, but what if it has been delivered and there's still a lot of bleeding?
Then they'll start by gently massaging the uterus from the outside
Okay.
to encourage those muscles to contract and clamp down on the blood vessels.
Right.
And they'll continue with the resuscitation measures we talked about and make absolutely sure that the entire placenta has been delivered.
No pieces left behind.
Exactly. And if the bleeding is really stubborn and doesn't respond to the massage, they might even use a technique called external bimanual compression.
External bimanual compression, what is that?
It's basically using both hands to apply constant pressure to the uterus,
Oh, wow.
squeezing it to manually control the bleeding. It's not a common procedure, but it can be a life-saving measure in extreme cases.
Wow, so it sounds intense,
Yeah,
but I guess when you're dealing with a life-threatening hemorrhage, you have to pull out all the stops.
exactly. You do what you got to do.
So we've covered a lot of ground today. Malpresentation, cord prolapse, postpartum hemorrhage,
Yeah.
a lot to take in.
It's a lot, but I think it's important to remember that these are rare scenarios.
Right.
The vast majority of births go smoothly.
Right. But I think it's valuable to have this knowledge.
No, absolutely. It gives us an appreciation for the expertise of these first responders and a deeper understanding of childbirth in general.
I think it's easy to get caught up in the idea that, childbirth is natural and everything will be fine.
Yeah, we don't always think about what could go wrong.
Right. And I think this deep dive has really opened my eyes to the fact that, things can get complicated. When they do, it's these first responders who are on the front lines.
That's right. They're the heroes of the moment.
They really are. So before we go to a break, I want to throw out a question to our listeners. Thinking about all of these potential complications, what questions would you ask a doctor or midwife about your own pregnancy or birth plan?
That's a great question.
Yeah, something to ponder as we continue our exploration of childbirth complications. So take a moment to think about that, and we'll be back in a flash with more from this fascinating deep dive.
Can't wait.
All right, so we're back, and we've been talking about all these different complications that can happen during childbirth.
Yeah, it's pretty intense stuff.
It is, but you know what? I think it's really easy to forget that at the center of all of this is the mother.
Absolutely.
We're talking about, medical procedures and emergency protocols and all that.
Right.
But it's important to remember that there's a human being going through all of this.
Her experience and her perspective are what matter most.
Totally. So I guess my question is, how do we connect what we've learned from this first responder perspective back to the mother's experience?
That's a great question. I think for starters, it highlights the importance of empowerment and informed decision-making.
Guys, I like that.
So even though this document focuses on these worst case scenarios,
Right.
it underscores the need for clear communication, respect for the mother's wishes,
Mm-hmm.
and a focus on her comfort and well-being throughout the entire process.
It also makes me think about the importance of having a birth plan
Mhm.
and, discussing potential complications with your healthcare provider in advance.
Absolutely. Having those conversations beforehand can really help to alleviate anxiety and make sure everyone's on the same page if things don't go exactly as planned.
Right. So it's not just about hoping for the best. It's about being prepared for those unexpected moments.
Exactly. Preparation is key.
We talked about how first responders communicate with the mother during an emergency. But what about the communication between the mother and her healthcare providers?
Ah, yes. That's where things like prenatal appointments, childbirth education classes, and open dialogue with doctors and midwives become so crucial.
So it's about building a relationship of trust and mutual understanding,
Exactly.
feeling heard, respected, and supported throughout the entire journey.
It's not just about the medical facts, but also about the emotional connection.
So it's really about recognizing the mother as an active participant in her own care.
Precisely. She has a voice and a choice in how her birth experience unfolds.
So I think we've gone on quite a journey in this deep dive.
We have.
From the adrenaline-fueled world of emergency response to the deeply personal experience of childbirth.
And it's been fascinating to see how those two perspectives intersect and inform each other.
Absolutely. We've explored the potential complications, the incredible skills of these first responders, the importance of communication and empowerment.
Yeah,
But there's still so much more to uncover.
there always is.
And I think that's the beauty of this kind of exploration. It opens up more questions than it answers.
It keeps us curious.
Exactly. So before we move on to the next part of this deep dive, I want to leave our listeners with one final thought-provoking question.
Okay, I'm listening.
Knowing what you now know about the complexities of childbirth and the potential for complications, what questions would you ask a doctor or midwife about your own pregnancy or birth plan?
That's a powerful question.
It is, right?
It really makes you think about what's important to you and how you can advocate for your own well-being.
So take some time to reflect on that question, and we'll be right back with the final part of our deep dive into childbirth complications.
Looking forward to it.
Right, welcome back for the final part of our deep dive into childbirth complications. And, we've been through a lot.
We have.
It's been a pretty intense journey.
Yeah, but hopefully a valuable one.
Absolutely.
Yeah.
We've learned about all sorts of things that can go wrong during labor and delivery.
Right.
But I think it's important to remember that the vast majority of births go smoothly.
Absolutely.
We're focusing on these rare scenarios so that we can appreciate the expertise of first responders and, just gain a deeper understanding of childbirth in general.
Yeah, I think it's easy to take childbirth for granted because it's such a natural process.
Right. But it's also a complex one, and things can go wrong sometimes.
And that's why it's so important to be informed.
Exactly. Knowledge is power.
Right. So even though this information we've been looking at, it's geared towards first responders, I think it's relevant for anyone who's pregnant, planning to become pregnant, or just curious about childbirth.
Oh, absolutely. I think everyone can benefit from understanding the potential complications, even the rare ones.
And I think, it's not about being afraid or anxious. It's about being prepared.
Exactly. It's about having the knowledge to make informed decisions about your care.
So for our listeners who are thinking, okay, this is all very interesting, but what does it mean for me? What are some key takeaways that they can apply to their own lives?
Well, I think one of the biggest takeaways, and this came up again and again in the document, is the importance of choosing a healthcare provider that you trust and feel comfortable communicating with.
Yeah, that's huge.
Someone who will listen to your concerns, answer your questions honestly, and respect your wishes every step of the way. So it's about finding a care team that supports your vision for your birth experience.
Exactly, whatever that might look like.
Right. And it's also about being proactive in your own health and well-being.
Absolutely, attending prenatal appointments, educating yourself about the stages of labor and delivery, and just having those open and honest conversations with your healthcare provider can make a world of difference.
So it's not about just blindly following orders. It's about understanding the why behind the recommendations.
Yes, and feeling empowered to ask questions and voice your preferences.
So it's about being an active participant in your own care.
Exactly. You're not just a passenger in this journey.
Right. And while we all hope for a smooth and uncomplicated birth experience, it's also important to acknowledge that, that there are factors beyond our control.
That's right.
Childbirth can be unpredictable.
It can.
And sometimes things just don't go as planned.
And that's when the expertise of healthcare professionals comes into play.
Right. So as much as we can prepare and plan, there's always an element of the unknown.
Yeah.
And that's why it's so important to have a care team that you trust.
Absolutely.
A team that's equipped to handle those unexpected situations and advocate for you and your baby.
That's what it's all about, having that support system.
I think this deep dive has really underscored the importance of having a supportive and knowledgeable team by your side throughout the journey.
It's not just about the medical interventions. It's about the human connection, the support system, and the feeling of being heard and respected throughout the process.
It's about recognizing that childbirth is not just a medical event. It's a transformative life experience.
Beautifully said.
So before we sign off, I want to leave our listeners with a final thought-provoking question.
Okay, hit me.
Knowing what you now know about the complexities of childbirth and the potential for complications, what questions would you ask a doctor or midwife about your own pregnancy or birth plan?
Wow, that's a great question.
Yeah, it's about taking all of this knowledge that we've talked about today and actually applying it to your own individual circumstances.
It's about being curious, asking questions, advocating for yourself and your baby.
Because knowledge is power.
It really is. And in the realm of childbirth, that power can make all the difference.
So thank you for joining us on this deep dive into childbirth complications.
Yeah.
We hope you found it informative and empowering. And remember, The journey of childbirth is unique for everyone. Embrace the unknowns, trust your instincts, seek support when you need it, and until next time, stay curious.
Bye, everyone.
All right, so we're back, and we've been talking about all these different complications that can happen during childbirth.
It's a lot to process.
Yeah, it is. But, before the break, we were talking about how in a lot of these emergencies, the best course of action is to just get mom to the hospital ASAP.
Right.
We keep mentioning this load and go approach.
Yeah, load and go.
But what does that actually look like in practice? Like, is it literally just throwing her in the ambulance and hitting the gas?
Well, it's a little more nuanced than that.
Yeah.
It's about, providing continuous care and monitoring during transport, making sure mom is as comfortable and stable as possible while they're racing to the hospital.
So it's like a mobile emergency room, basically.
Exactly. They're trained to handle all sorts of medical procedures in the back of that ambulance.
Wow. So walk us through it. What are some of the things they're doing en route to the hospital?
Well, first and foremost, they're focused on mom's safety and comfort.
Makes sense.
So they'll use a special stretcher that's designed for pregnant women.
Okay.
Make sure she's properly secured and positioned to minimize any discomfort.
And I imagine keeping mom calm and reassured is a big part of it, too.
Absolutely. Communication is key in these situations.
Right.
They'll be talking to her constantly, explaining what they're doing, answering any questions she might have, just generally trying to keep her spirits up.
Yeah.
And of course, they're closely monitoring her vital signs,
I bet.
blood pressure, heart rate, making sure everything's stable.
What about the baby? Are they able to monitor the baby's heartbeat during transport?
Oh, absolutely. Fetal monitoring is a critical part of that load and go protocol. They'll use a handheld Doppler device to listen to the baby's heartbeat at regular intervals, making sure there are no signs of distress.
So they've really got their eyes on both patients.
Yeah, it's pretty amazing.
That's incredible. And I'm guessing they're also in communication with the hospital?
Oh, you bet. They'll radio ahead to the receiving hospital.
Okay.
Give them a detailed report of the situation.
Okay.
Mom's condition, the suspected complication, any interventions they've already performed.
Got it. So the hospital staff can be ready.
Exactly. They can prepare for their arrival, have the right medical team and equipment ready to go.
It's like a well-choreographed dance, except the stakes are incredibly high.
It really is a testament to their training and professionalism.
Okay, so let's go back to postpartum hemorrhage for a moment.
Okay.
We talked about those 4 T's, tone, tissue trauma, and thrombin, that paramedics use to kind of assess the situation.
Yeah.
Can you unpack those a little bit more for, like, what are they actually looking for when they're going through that mental checklist?
Yeah, so it's a really brilliant system, actually. So the first T-tone, that's all about the uterus itself. Remember how we talked about the importance of the uterus contracting after birth to control the bleeding?
Yes.
Well, they're literally feeling the mother's abdomen to check the tone of the uterus. They want to make sure it's firm and contracted, which is a good sign.
Okay.
If it feels soft and kind of boggy, that could indicate uterine atony.
Oh, right.
Which is one of the main causes of postpartum hemorrhage.
So they're getting hands-on to assess the situation?
Yeah, they're not afraid to get in there.
Okay, what about tissue?
Tissue is all about the placenta. So once the placenta is delivered, they examine it very carefully to make sure it's complete, meaning no pieces are left behind inside the uterus.
Right.
Because retained placental fragments can actually prevent the uterus from contracting properly.
Got it. And that can lead to more bleeding.
Exactly.
Okay, so tissue is like a quality control check for the placenta.
That's a good way to put it.
What about trauma?
So trauma is all about checking for any injuries that might be contributing to the bleeding childbirth. Can be tough on the body.
Yeah, no kidding.
And sometimes tears or lacerations can occur in the birth canal, so the paramedics will visually inspect the perineum.
Okay.
That's the area between the vagina and the anus, looking for any signs of injury.
Okay, so they're looking for any tears or cuts that might need attention.
Exactly.
What about that last T thrombin?
So thrombin refers to the body's natural clotting factors. It's a little more technical, but essentially thrombin is a key player in the process of stopping bleeding.
Okay.
So in severe cases of postpartum, hemorrhage medications that promote clotting might be necessary, but that's usually handled at the hospital.
So it sounds like those 4 T's really help them narrow down the cause of the bleeding and guide their treatment approach.
Absolutely. It's like a roadmap for them.
Even in the back of a speeding ambulance.
Even then.
As we're talking about all of this, I'm realizing how much emphasis is placed on communication in these emergency situations.
Oh, yeah.
Not just between the paramedics and the hospital, but also between the paramedics and the mother.
Right.
Why is that so important?
Well, think about it. You're in labor, possibly experiencing a terrifying complication,
Uh-huh.
and then these strangers show up and start doing all sorts of things to you. It's a very vulnerable situation.
I can only imagine.
So clear communication is essential for building trust and making sure the mother feels safe and informed.
So are they basically explaining everything they're doing step by step?
As much as possible, yeah, they want to make sure she understands what's happening and why.
Okay.
It's all about empowering her, even in a really scary situation.
Right. It sounds like it takes a special kind of person to be a paramedic.
Yeah.
Someone who's not only skilled medically, but also compassionate and empathetic.
Yeah, they definitely have a tough job.
It really makes me realize that, childbirth is not just a medical event, it's a profoundly human experience.
That's a beautiful way to put it.
And it seems like these first responders are really playing a crucial role in both the medical and emotional aspects of these emergencies.
Absolutely. They're there for the whole person, not just the physical body.
So we've been focusing a lot on the first responder perspective,
Right.
which is fascinating.
Yeah.
But it's important to remember that at the center of all of this is the mother.
Of course.
Her experience, her perspective are paramount.
Absolutely.
So how do we connect what we've learned from this first responder perspective back to the mother's experience?
That's a really important question. I think for starters, it highlights the importance of empowerment and informed decision making.
Okay.
So even though this document is, all about emergency scenarios, it
Yeah.
really underscores the need for clear communication, respect for the mother's wishes,
Yeah.
and a focus on her comfort and well-being throughout the entire process.
It also makes me think about the importance of having a birth plan and discussing potential complications with your healthcare provider in advance.
Yeah, those conversations are so crucial.
Right.
Having them beforehand can help to alleviate anxiety and ensure that everyone is on the same page if unexpected situations arise.
Right. So it's not just about hoping for the best, it's about being prepared for those what-if moments.
Exactly. Preparation is key.
We talked about how first responders communicate with the mother during an emergency. But what about the communication between the mother and her healthcare providers throughout the entire pregnancy and labor process?
That's where things like prenatal appointments, childbirth education classes, and open dialogue with doctors and midwives become so important.
Right.
It's about building a relationship of trust and mutual understanding.
So it's not just about the medical facts, but also about the emotional connection.
Absolutely. It's about feeling heard, respected, and supported throughout the journey.
So it's really about recognizing the mother as an active participant in her own care.
Exactly. She has a voice and a choice in how her birth experience unfolds.
And I think that's a perfect segue into the final part of our deep dive, where we'll explore how expectant parents can use this knowledge to empower themselves and advocate for their own well-being.
I'm excited for that.
So stay tuned, folks. We'll be right back. All right, welcome back. And, we've been talking about all these different complications that can happen during childbirth.
It's a lot to take in for sure.
It is. But you know what? I think it's really easy to forget that at the center of all of this is the mother.
Right.
We've been talking about medical procedures and emergency protocols and all that.
Yeah.
But it's important to remember that there's a human being going through all of this.
Absolutely. Her experience and her perspective are what matter most.
Exactly. So how can we connect what we've learned from this first responder perspective back to the mother's experience?
That's a great question. And I think for starters, it really highlights the importance of empowerment and informed decision making.
Okay.
So even though this document, focuses on these kind of worst case scenarios, it underscores the need for, clear communication, respect for the mother's wishes, and a focus on her comfort and well-being throughout the whole process.
And it makes me think about the importance of having a birth plan and discussing potential complications with your healthcare provider, like in advance.
Absolutely. Having those conversations beforehand can help to alleviate anxiety and make sure that everyone is on the same page if things don't go exactly as planned.
Right. So it's not just about hoping for the best. It's about being prepared for those unexpected moments.
Exactly. Preparation is key.
We talked about how first responders communicate with the mother during an emergency, but what about the communication between the mother and her healthcare providers throughout the entire pregnancy and labor process?
Yeah, that's where things like prenatal appointments, childbirth education classes, and open dialogue with, doctors and midwives become so crucial.
So it's about building that relationship of trust and mutual understanding,
Exactly.
feeling heard, respected, and supported throughout the entire journey.
It's not just about the medical facts. It's also about that emotional connection.
So it's about recognizing the mother as an active participant in her own care.
Precisely. She has a voice and a choice in how her birth experience unfolds.
I think we've gone on quite a journey in this deep dive.
We have.
From the adrenaline-fueled world of emergency response to the deeply personal experience of childbirth.
It's been really fascinating to see how those two perspectives intersect and inform each other.
We've explored the potential complications, the skills of these first responders, the importance of communication and empowerment.
Yeah.
But there's still so much more to uncover.
Oh, there always is.
And I think that's the beauty of this kind of exploration. It opens up more questions than it answers.
It keeps us curious.
Exactly. So before we wrap up this episode, I want to leave our listeners with one final thought-provoking question.
Okay, I'm all ears.
Knowing what you now know about the complexities of childbirth and the potential for complications, what questions would you ask a doctor or midwife about your own pregnancy or birth plan?
That's a powerful question.
It is, right.
It really makes you think about what's important to you and how you can advocate for your own well-being.
So we encourage all of our listeners to really reflect on that question and think about what matters most to you in your childbirth journey.
And remember, knowledge is power.
It really is. And in the realm of childbirth, that power can make all the difference.
Absolutely.
Well, that brings us to the end of our deep dive into childbirth complications. We hope you found it informative and empowering. And remember, the journey of childbirth is unique for everyone. Embrace the unknowns, trust your instincts, seek support when you need it, and until next time, stay curious.
Bye, everyone.
You know how people say childbirth is like a box of chocolates?
You never know what you're going to get.
Right. Well, today's deep dive
Is all about being ready for.
yeah, those unexpected moments.
Especially
When it comes to twin births and those tricky situations.
like malpresentation.
Yeah, malpresentations.
Exactly.
We're going to unpack some fascinating insights from the PESP instructor skill station sheets. This is the material that's used to train paramedics
Yes.
for different birth scenarios.
Absolutely.
Think of it as like a backstage pass
Behind the scenes.
to emergency preparedness.
Absolutely. And what's particularly interesting is how these sheets highlight not only the procedures,
Oh, yeah.
but also the critical thinking paramedics need to employ in these often high-pressure situations.
So we're not just talking about,
Rote memorization.
yeah, just memorizing steps, but like really understanding the why behind those actions.
Exactly.
Interesting.
Let's take breech birth as an example.
Okay.
It can happen in any birth, single or multiple, and it basically means the baby is positioned to be born feet or bottom first instead of head first.
Okay.
Paramedics are trained in a specific technique called the Mariso Smelly Vate maneuver
Oh, wow.
to help guide the baby safely.
That's a mouthful.
It is a mouthful, I know.
Yeah.
But the technique is all about minimizing handling
Okay.
to prevent any potential damage to the baby and avoid stimulating them to breathe too early.
I imagine that takes a lot of precision
It does.
and like a very steady hand.
It does. I remember observing a paramedic using this maneuver during a particularly challenging breech birth.
Oh, wow.
The mother was understandably anxious,
Of course.
but the paramedic remained calm and focused,
Yeah.
carefully supporting the baby's spine and chest while applying just the right amount of pressure above her pubic bone.
Wow.
It was a delicate dance of supporting and guiding the baby, ensuring a safe delivery for both mom and baby.
That must have been incredible to witness.
It was
Like it really highlights the level of skill involved.
absolutely.
Now, thinking about surprises,
Yeah.
what about those situations where twins arrive unexpectedly?
Undiagnosed twins.
Yeah, undiagnosed twins, as they call them.
Yeah.
Is that really a thing?
It happens more than you might think. Here in Ontario, twin births account for about 4% of all deliveries.
Okay.
But the surprising part,
Yeah.
up to 20% of those twin pregnancies might go undetected without an ultrasound.
Wow.
So imagine the surprise when a second baby makes an appearance
Right.
after the first one is already here.
That's a lot of unexpected siblings popping up.
It is.
What clues would tip off a paramedic
That they might be dealing with.
that they might be dealing with more than one baby?
There are a few things they look for.
Okay.
The first baby might be smaller than expected for a single birth.
Right.
Or the top of the uterus, what we call the fundus, might still be high,
Uh-huh.
suggesting there's something else in there.
Okay.
Sometimes they can even feel fetal parts,
All right.
indicating another baby is on the way.
Okay. So let's say a paramedic has delivered the first baby
Yeah.
and there's a strong suspicion of a second twin.
Right.
What happens then?
It becomes a race against time. But with a focus on ensuring both babies are safe,
Gotcha.
the first step is immediately clamping the cord of the first baby.
Which might seem counterintuitive.
It might. It's
Yeah.
crucial
Yeah.
to prevent the second twin from potentially losing a significant amount of blood
Why?
while the cord is still pulsing.
That makes sense. You don't want one twin getting all the blood while the other is still on the way.
Exactly.
Okay.
Then, of course, they inform the patient and family about what's happening.
But you can imagine.
It's quite a shock.
Yeah. Big surprise.
While providing care to the first baby, they're also checking the mother for any complications,
Such as.
like bleeding or a prolapsed umbilical cord, which is when the cord slips down in front of the baby.
Go.
Getting everyone to the hospital quickly becomes an absolute priority.
So it's a delicate balance of managing the immediate needs of
Both the mother
both the mother and the first baby.
and the first baby,
Yeah,
while preparing for the arrival of the second.
it is.
And while the ideal time between births hasn't been definitively established,
Right.
paramedics have to make quick decisions based on the mother's stability,
Yeah.
the baby's positions,
Uh-huh.
and the distance to the hospital.
Okay.
They might need to transport immediately after the first baby is born,
Gotcha.
or they might have some time to prepare for the second delivery right there on scene.
It sounds incredibly intense.
It can be.
What happens if the second baby decides to make their entrance before transport is possible?
Paramedics are trained to handle that too.
Okay.
The second baby usually arrives about 20 to 30 minutes after the first.
Right.
But if it's imminent, they'll deliver the baby,
Yeah.
whether it's head first or at another breech presentation.
Okay.
The key is to clearly identify twin B by placing 2 clamps on the umbilical cord
Right?
to avoid any mix-ups later on.
Wow. It's like a synchronized dance of life-saving maneuvers.
It is.
And speaking of multiple deliveries,
Yeah,
I imagine things get even more complex when we're talking about premature babies,
absolutely.
especially with twins.
You're absolutely right.
Yeah.
Prematurity, which means a baby born before 37 weeks of gestation,
Okay.
brings a whole set of additional concerns.
Yeah.
Twin pregnancies already have a higher risk of preterm delivery,
Huh.
along with other potential challenges
Such as?
like congenital anomalies, low birth weight, and postpartum hemorrhage,
Postpartum hemorrhage.
which is excessive bleeding after childbirth.
Right.
So
It sounds like paramedics.
have their hands full.
Yeah, have their hands full in those situations.
Absolutely.
What are the immediate priorities when a preterm baby is born outside of a hospital setting?
The absolute top priority is preventing hypothermia.
Oh, okay.
Those tiny bodies lose heat rapidly.
Yeah.
So paramedics have a multi-pronged approach to keep those babies warm.
Okay.
Gentle handling is key to minimize stress.
Right.
And skin-to-skin contact with the mother, if possible, is incredibly effective.
I can imagine.
They'll wrap the baby in warm blankets,
Yeah.
make sure their head is covered with a hat,
Oh, okay.
and even increase the temperature in the ambulance.
Wow.
Sometimes they might even use a specific heat source designed for newborns.
Oh, wow.
And of course, limiting exposure to cold air is crucial.
It sounds like every second counts in those situations.
It does.
And once the placenta or placentas are delivered,
Right.
paramedics are also focused on the mother's well-being.
Absolutely.
What do they do?
They'll perform external uterine massage,
Okay.
which helps the uterus contract and minimizes the risk of excessive bleeding.
So it's really a team effort ensuring both mom and babies are getting the care they need.
It is.
Now, let's shift gears a bit and talk about something called malpresentation.
Okay.
What exactly does that mean?
Malpresentation is essentially any position where the baby isn't head down,
Okay.
ready to enter the birth canal. It could mean the baby is lying sideways across the uterus,
Oh, wow.
which is called a transverse lie,
Okay.
or even with the shoulder presenting first.
Right.
There's also something called an unstable lie,
Uh-huh.
where the baby's position keeps changing.
Okay.
The key point to remember is that babies can't be born safely in these positions.
Right.
Malpresentation increases the risk of complications like the umbilical cord slipping down in front of the baby,
Which is called...
which is called cord prolapse.
Right.
Or the labor getting obstructed because the baby can't move down the birth canal.
Those all sound like serious complications.
They can be.
Are there any signs during pregnancy that might indicate a malpresentation?
There are a few clues.
Okay.
Sometimes the mother's abdomen might look unusually wide or asymmetrical,
Okay.
or the top of her uterus might measure lower than expected for the stage of pregnancy.
Okay.
And often the mother herself might report feeling the baby's head on one side of her abdomen instead of down low, which is where it should be.
Right.
So
So it's a combination of physical signs and listening to what the mother is experiencing.
precisely.
Gotcha.
And let's say a paramedic encounters a situation where a limb is presenting first.
Uh-huh.
That's a definite red flag.
Okay.
They absolutely would not attempt to push the limb back in.
Right.
Instead, they'd discourage the mother from pushing,
Yeah.
gently cover the limb with a dry sheet to keep it warm,
Okay.
and initiate transport to the hospital as quickly and safely as possible.
Yeah, it sounds like clear communication and swift action are crucial in those moments.
They are.
And while all of this might sound a bit overwhelming.
It can be. I
Yeah.
think it's important to remember that these situations,
Yeah.
while serious, are thankfully not that common.
Oh.
Paramedics are highly trained to handle these scenarios,
Right.
and they have a deep understanding of the nuances involved in each situation.
That's reassuring to hear.
It is.
It's amazing to think about the level of knowledge and expertise they bring to those critical moments.
Yeah.
But what about the expectant parents themselves?
Uh-huh.
How does knowing all of this information benefit them, even if they're not the ones delivering the babies?
That's a great question.
Yeah.
And it brings us to a point I'm particularly passionate about.
Okay.
While this information is primarily used to train paramedics,
Right.
I believe it's valuable for anyone who wants to learn more about childbirth,
Yeah.
especially expectant parents.
I love that.
Yeah,
It's like you said earlier, it's about understanding the why behind the actions,
exactly.
which can empower people to make informed decisions.
Knowledge is power.
Yeah.
And when it comes to something as profound as childbirth, that power can translate into a sense of confidence and control,
Yeah.
even in the face of the unexpected.
So it's not about creating fear or anxiety,
No, not at all.
but rather equipping people with the knowledge to ask informed questions
Exactly.
and advocate for themselves during pregnancy and labor.
Absolutely.
I like that.
By understanding the possibilities, both common and rare expectant parents can have more meaningful conversations with their healthcare providers and feel more prepared, both emotionally and practically, for the journey ahead.
That's a wonderful way to frame it.
Thank you.
It's about embracing the unpredictable nature of childbirth while also feeling empowered to navigate those uncharted waters.
Exactly.
We've covered so much ground today, from breech births and undiagnosed twins
Yeah.
to the intricacies of managing premature babies and recognizing the signs of malpresentation.
Yeah.
It's clear that paramedics play a vital role in ensuring the safe arrival of these little ones.
Absolutely.
But as you've highlighted, there's a valuable takeaway here for all of us,
Yes.
even if we're not medical professionals.
And what would you say is the most important thing for our listeners to remember as they continue their own journeys through pregnancy and childbirth?
Because knowledge truly is the key
Yes.
to feeling confident and empowered in
Absolutely.
all aspects of life, especially when it comes to welcoming a new life into the world.
Right.
This deep dive has definitely opened my eyes to the complexities of childbirth
It is complex.
and the incredible skills paramedics bring to those unexpected moments.
Yeah, they're amazing.
It's like we've been given a glimpse behind the curtain,
A little peek.
not just into the procedures themselves,
Right.
but into the decision-making process and the compassion that guides those actions.
Impressive for sure.
And I hope it empowers our listeners to engage in those conversations,
I hope so too.
to ask those what-if questions,
Exactly.
and to feel confident in their ability to advocate for themselves and their babies throughout this incredible journey.
It's a journey unlike any other.
So to our listener, thank you for joining us on this deep dive into the unexpected world of twin births and malpresentations.
It's been a pleasure.
We hope you found it as insightful and empowering as we did.
And remember, every birth story is unique
That's true.
and unfolds in its own way.
Did that.
Embrace the unknown, stay curious, and never underestimate the strength and resilience of the human body,
Yeah.
both the mothers and the babies.
Until next time, keep those questions coming and never stop exploring the fascinating world around us.
See you next time. All right, so welcome to the deep dive. We're diving into some pretty intense stuff today.
Yeah, definitely.
2 childbirth complications. Paramedics need to be on top of their game
Yeah.
for shoulder dystocia and breech births.
Mm-hmm.
You're probably listening to this because you're prepping for real-world scenarios.
For sure.
So we're going to go deep into this paramedic training guide I found.
Okay.
Make sure you've got the knowledge you need.
Yeah, it always gets me how childbirth
Uh-huh.
This natural process, right? Like, we think of it as routine.
Yeah.
It can become so high stakes
Mm-hmm.
and so fast. And
Absolutely.
for paramedics, it's like being that calm in the storm,
Yeah.
knowing what to do when things get complicated.
Exactly. Okay, so first up, shoulder dystocia guide says it happens in 0.2 to 3% of vaginal births.
Mm-hmm.
Might not sound like much, but
It's enough.
oh, it's enough to be a real concern.
Yeah. And actually,
Yeah.
those numbers go up
Oh,
for
yeah.
mothers with diabetes
Oh.
or who are carrying larger babies.
Mm-hmm.
And there's like a 12% chance of it happening again
Oh, wow.
if a woman has already had shoulder dystocia in a previous birth.
So once you've had it once, you're kind of
Yeah, more likely to.
more likely to,
Yeah.
to have that happen again.
Mm-hmm.
Okay, so for someone who has never encountered it,
Right.
what even is shoulder dystocia?
So basically, it's when the baby's head is born,
Okay.
but one or both shoulders get stuck behind the mother's pelvic bone.
Oh, wow.
It's a situation where you need to act fast
Yeah.
because the baby's oxygen supply is compromised.
Yeah, this guide actually mentions that irreversible brain damage
Oh, yeah.
can occur in newborns
Mm-hmm.
just 8 minutes
Wow.
after the head is born.
Yeah.
If they're not getting enough oxygen.
It's a scary thought.
Yeah.
It is. It is.
So how do you even know it's happening?
Right.
Are there like clear signs?
So there are a few visual cues that paramedics look for.
Okay.
One is called the turtle sign. So the baby's head emerges, but then it retracts back into the perineum.
It's almost like,
It's almost like the baby's head is trying to go back in.
oh, wow. So that's a pretty,
It's a pretty clear sign.
yeah, you can't miss that, right?
It's usually not.
Okay.
Another sign is cyanosis of the fetal head,
Okay.
meaning the baby's head starts to turn blue from lack of oxygen.
So you see the head and then it starts to kind of
Yeah, you'll see.
the color a little bit.
Yeah, you'll see a change in color, and that's a bad sign.
Okay, so let's say a paramedic spots those signs. What happens next?
Okay.
This guide mentions a two-step delivery.
Yeah, so a two-step delivery is basically just the normal process of birth.
Okay.
The baby's head emerges first.
Right.
There's a brief pause,
Yeah.
and then the rest of the body is delivered.
Okay.
And it's important to note that this natural pause
Mm-hmm.
doesn't increase the risk of complications.
Yeah, okay.
It can actually reduce the chances of shoulder dystocia
Oh, wow.
compared to rushing the delivery.
So you don't want to rush it, but you also need to be ready
Right.
away.
You've got to be prepared.
It happens to act fast.
Yep.
Okay, so what tools do paramedics have to handle shoulder dystocia when it does happen?
So paramedics rely on a mnemonic to remember the steps.
Ah, mnemonics. Always helpful.
Right.
Yeah.
This one is ALARM.
Okay, let's break it down. What
Yeah.
does A stand for?
A stands for ask for help,
Okay.
which emphasizes the importance of teamwork.
Makes sense.
You need at least 2 people to manage shoulder dystocia effectively.
Absolutely. You need an extra set of hands at least, right?
At least.
Okay, so L. What's L?
L is for lift legs into McRoberts maneuver.
Okay.
So you're bringing the mother's thighs up towards her abdomen,
Oh, okay.
almost like she's in a squatting position.
I see.
And it's a surprisingly effective way to create more space for the shoulders to pass through.
Yeah, you would think intuitively you would want to make space.
All right.
Right.
Yeah.
But how does that work anatomically?
So basically the McRoberts maneuver, it optimizes the position of the pelvis.
Oh.
So it helps the baby navigate the birth canal better.
So repositioning is key.
It is. It is.
And is the McRoberts, is that kind of the go-to for shoulder dystocia?
It's definitely one of the cornerstones.
Okay.
It resolves about 20 to 40% of cases.
Wow.
And it has the lowest risk of injury to the baby.
Okay, that's good.
Yeah.
So ask for help, lift legs.
Mm-hmm.
What's the second A?
That A is for adduct shoulder,
Okay.
which means applying suprapubic pressure.
All right.
So the paramedic will gently push the baby's shoulder towards their chest,
Okay.
helping to dislodge it
I see.
and guide it into a better position.
So it's a combination of repositioning the mother and then kind of gently guiding the baby.
Exactly. You got it.
Okay, R. Any guesses?
All right. What do you think R is?
We've already repositioned the legs. Mm-hmm. So I'm going to guess repositioning something else.
You got it. R stands for roll the mother.
Okay.
It's called the Gaskin maneuver,
All right.
where the mothers help to roll onto her hands and knees.
I'm trying to picture that.
Yeah.
How would that help with shoulder dystocia?
So every shift in the mother's position
Mm-hmm.
potentially changes the angle and the space within the pelvis.
Okay.
And sometimes that's enough to dislodge the stuck shoulder.
Oh, so it's almost like you're trying to
You're trying to,
like jiggle it loose a little bit.
yeah, kind of. You're trying to create a different
Mhm.
angle just shift things around.
That's interesting.
Yeah. So you're not directly.
Not always directly manipulating
Yeah.
the baby. It's more about repositioning the mom.
Gotcha. Interesting.
Yeah.
So with that gasket maneuver, you're trying to kind of get things unstuck.
Yeah, hoping to free up that shoulder.
Okay. And the final step, the M.
Right. M stands for manually deliver the posterior arm,
Okay.
but only if the paramedic can clearly see and reach the arm.
So it's
It's not something you do routinely.
Gotcha.
Yeah, you want to try those less invasive options first,
Okay. Makes sense.
like the McRoberts and the Gaskin maneuvers.
Yeah. So it sounds like the key with shoulder dystocia. Recognizing the signs early
For sure.
and acting quickly but calmly.
Yeah, exactly. Throughout the whole process,
Uh-huh.
the paramedics are constantly monitoring both mom and baby,
Right.
making sure their vitals are stable.
Yeah. Time is of the essence.
Definitely.
But you don't want to rush the delivery.
Right, exactly. It's a balance.
Okay. Well, let's shift gears now
Okay,
to our second topic.
great.
Breech births.
Yeah.
What exactly does that mean?
So in a typical birth, the baby is head down, ready to enter the birth canal head first.
Right.
But in a breech birth,
Yep.
the baby is positioned with their feet or buttocks closest to the birth canal.
Okay.
And there are a few variations of breech presentations.
Oh.
Frank breech, where the legs are extended upwards towards the head. Footling breech, where one or both feet are presenting first.
Okay.
And complete breech, where the baby's essentially sitting cross-legged. Wow, okay, so it's almost like the baby's trying to come out
Yeah.
feet first or even bottom first.
Yep.
So how do paramedics know that they're dealing with a breech birth?
So there are a couple of signs.
Okay.
One is the fresh passing of dark meconium, which is the baby's first stool.
Right.
And this can be a sign the baby's under stress.
Okay.
The other, of course, is actually seeing the baby's buttocks, leg, or foot.
Oh, so you can actually see
Yeah, you can sometimes...
it's coming out
Yeah.
first. That
Uh-huh.
seems pretty clear.
Yeah.
So when a paramedic realizes it's a breech birth,
Right.
what's the first course of action?
It's often a hands-off approach initially.
Really?
Yeah, we want to allow gravity to assist
Okay.
and encourage the baby to descend naturally as much as possible.
That's not what I would have thought.
Yeah, I know it seems counterintuitive,
Yeah.
but interfering too soon can make things more difficult.
So you're really letting nature
Yeah, train
take
over
its course as long as it's safe.
Exactly.
Okay, so hands off at first, but at some point you have to intervene.
Right, so once the baby's body has descended enough,
Okay.
we use a maneuver called the Moriso-Smelly-Vate maneuver.
That's a mouthful.
It is.
So can you break that down?
Yeah, so it's all about precision and a gentle touch.
Okay.
The main principles are to support the baby's spine throughout, carefully lift the body to help birth the face,
Okay.
and apply gentle pressure above the mother's cubic bone
I see.
to guide the head out.
So we're minimizing handling here.
Yeah, absolutely.
Why is that so important?
Because a breech baby is in a more vulnerable position.
Right.
Excessive handling could damage their internal organs
Oh.
or bones.
Okay.
So the Moriso-Smelly-Vate maneuver, it's designed to provide just the right amount of guidance
Okay.
and support without adding unnecessary pressure.
So it's like a dance almost
It is.
between assisting and letting things happen naturally?
Yeah, finding that balance.
Yeah, okay. So you mentioned supporting the spine
Mhm.
and lifting the body. Can you walk us through those steps?
Sure. So first we want to maintain the baby's flexion,
Okay.
keeping their chin tucked to their chest
Mm-hmm.
to present the smallest possible diameter as they move through.
Oh, that makes sense.
Yeah. And then as the body descends,
Mm-hmm.
we gently lift it upwards to help the face emerge
Okay.
so the baby can breathe as soon as possible.
That must be such a relief
It is.
when you see that little face.
Yeah.
finally.
And then comes the precise part.
Okay.
As the face is being born,
Mhm.
we support the baby's chest and cheekbones with our hand and forearm,
I see.
taking care not to put fingers in the baby's mouth.
Why is that?
Putting fingers in the mouth could trigger a gasp reflex,
Okay.
potentially leading to them inhaling amniotic fluid or meconium,
Oh.
which can cause breathing problems.
So you don't want to...
You want to minimize any unnecessary stimulation.
Yeah. Okay, so the body's out, face is born. What's next?
The final part is applying gentle suprapubic pressure,
Okay.
basically pressing just above the mother's pubic bone
Mm-hmm.
to help guide the baby's head out.
Wow. It really is a balancing act, isn't it?
It is. It is.
Supporting the baby,
Mm-hmm.
guiding the head,
Yeah.
all while being so mindful of their little body.
It requires a high level of skill and awareness.
Absolutely.
And remember, throughout this entire process,
Yeah.
we're constantly checking the baby's well-being. Make sure they're
Yeah.
breathing properly and their heart rate is good.
It's pretty amazing that paramedics can handle all this.
Well, we have to be prepared for anything.
Yeah.
Breech births are just one example.
Yeah, so we've focused so far on the immediate management
Question.
of both shoulder dystocia and breech births.
Uh-huh.
But are there any broader implications to consider?
Absolutely. Both shoulder dystocia and breech births can have short-term and long-term consequences.
Like what?
For the mother,
Yeah.
shoulder dystocia can lead to postpartum hemorrhage, which is excessive bleeding after childbirth.
Right.
It can also cause tears in the vagina or cervix,
Mm-hmm.
and in rare cases, uterine rupture.
Wow, that's serious.
Yeah, it is.
For the baby.
So for the baby.
We talked about the oxygen deprivation.
Right. So besides the risk of brain damage from lack of oxygen,
Yeah.
shoulder dystocia can also lead to brachial plexus injuries.
Okay.
These affect the nerves that control the arm and hand.
Oh, wow.
And in severe cases, these injuries can have long-term effects.
On their movement.
Yeah, on their movement and sensation.
Yeah, that's tough.
Sad.
Yeah.
What about breech births?
So for mothers, breech births carry a higher risk of infection,
Okay.
perineal tears,
Mm-hmm.
and postpartum hemorrhage,
What?
much like shoulder dystocia.
Right.
And for babies, there's an increased risk of birth trauma,
Right.
like bone fractures or dislocations,
Uh-oh.
as well as asphyxia.
So there are some similarities
So
and complications for both mom and baby.
there are, and that's why
Ongoing research and improvement of medical practices
Mm,
are so important.
yeah, to try to minimize these risks.
Exactly.
Okay, and you mentioned earlier that there were broader implications.
Right.
What are some of those areas that researchers are focusing on?
Well, one area is the long-term impact on a mother's mental health,
Okay.
experiencing a traumatic birth,
Huh.
like shoulder dystocia or a breech presentation.
Yeah.
It can increase the risk of postpartum depression, anxiety,
Right.
even PTSD.
It makes sense.
It does.
You go through something like that.
Yeah, it can be very traumatic.
And it's not just about physical recovery.
No, it's mental and emotional too.
Exactly. And what about for the baby?
Researchers are also looking at long-term developmental outcomes
Okay.
for children who experience shoulder dystocia or breech births.
Hmm.
Some evidence suggests a slightly higher risk
Okay.
for certain developmental delays or disabilities.
So there's still a lot to learn.
Yeah, there's always more to learn.
But it sounds like we're getting a better picture
We are.
of these complications as we do more research.
Absolutely.
It's reassuring that there's so much work being done
It is.
to improve outcomes for mothers and babies.
It's an evolving field, you know?
Yeah.
As we learn more, we can adapt our
Yes.
practices and provide better, more informed care.
Well, this has been a really intense deep dive.
It had.
I feel like I've learned a lot
Good.
about these complications.
It's fascinating, isn't it?
Yeah, it is.
How much depth there is
Mhm.
to these seemingly straightforward complications.
And, as we were talking about all this,
Yeah.
I was thinking, this information,
Mm-hmm.
it's not just relevant for paramedics.
Right.
It's valuable for anyone involved in the building process.
Absolutely.
Expectant parents, family members, doulas.
Right.
Anyone knowing what could happen can help everyone stay calmer.
Right. Be more supportive.
Yeah, imagine being a doula or a partner during a birth
Yeah.
where shoulder dystocia happens. Even just understanding what the McRoberts maneuver is
Right.
could help you stay calm.
Exactly.
Yeah.
And it's not just about knowing the steps,
Yeah.
but grasping those underlying principles.
Yeah.
Like knowing that the McRoberts maneuver is all about creating space
Right.
can help you visualize what's happening.
Yeah, and it takes away that.
Yeah, the fear of the unknown when you
Yeah.
understand what's going on,
Yeah.
it feels less overwhelming,
Okay.
even if it's a challenging situation.
It's like having a toolkit, right?
Yeah.
Even if you never use the tools,
Yeah, just knowing.
it's good to know that they exist.
Yeah.
And speaking of tools,
Mhm.
one we haven't mentioned explicitly is communication.
Oh, absolutely.
Clear, open communication is vital.
Yeah, in these situations.
Paramedics need to be on the same page as each other. The
Yeah.
hospital team, the patient, the family,
Everyone.
everyone needs to be in the loop.
Yeah, and for the person giving birth
Mhm.
and their support team. It's crucial to feel comfortable asking questions,
Right.
expressing concerns, advocating for their needs.
So it's a two-way street.
It is. It is.
Teamwork, shared decision-making,
Yeah.
even in a stressful situation.
Exactly. And that's a powerful message for our listeners.
Absolutely.
Knowledge is essential.
Mm-hmm.
Preparation is key.
Yeah.
But so is open,
Hmm.
honest,
Right.
and respectful communication.
By working together,
Yeah.
we can create a better experience
No.
for everyone involved.
For everyone.
This deep dive has been so insightful.
It's good. My pleasure.
Really appreciate your expertise.
Of course.
And to our listeners, thank you for joining us.
Yeah. Thanks for listening.
We hope you've learned something valuable today.
We hope so.
Remember, knowledge is power.
Absolutely.
Stay curious, stay informed,
So curious.
and keep advocating for better maternal and infant health outcomes.
Yeah. That's important.
Until next time, keep diving deep.
Keep diving.
So before we wrap up, one last question for you.
Okay, shoot.
Given everything we've talked about today,
Mm-hmm.
what's the one thing you want our listeners to take away
Well, that's a good one.
when it comes to shoulder dystocia and breech births?
I think it's important to remember
Yeah.
that it's not just about memorizing maneuvers and statistics.
Right.
It's about understanding the why behind it all.
The why.
Yeah, like why these complications happen,
Right.
what the risks are,
Yeah.
and most importantly, how to respond effectively.
To ensure the best possible outcome.
Exactly, for both mom and baby.
That's a great point. And, you
Yeah.
know,
Yeah.
it really highlights that these are complex situations that
Yeah.
require a deep understanding
Very cool.
of the anatomy and physiology involved.
Yeah, and a lot of critical thinking skills.
Yeah, you can't just rely on rote memorization.
Nope, you got to be able to adapt and think on your feet.
Because every birth is different.
Exactly, every situation is unique.
Well, I think we've given our listeners a lot to think about today.
I hope so.
And hopefully a renewed appreciation for the complexity of childbirth
Absolutely.
and the incredible skills that paramedics bring to these situations.
Couldn't have said it better myself.
So to our listeners out there, thank you for joining us on this deep dive.
Yeah, thanks for listening.
We hope you found it informative and engaging.
We hope you learned something new.
And as always, stay curious, stay informed, and keep diving deep.
Keep on diving.
All right, buckle up, everybody. We're about to take a deep dive into a world that's both fascinating and a little bit intense.
Intense is right.
Yeah, we're talking about precipitous childbirth. You know, those births that happen like lightning fast.
Sometimes in under 3 hours.
Exactly, 3 hours. Can you imagine? And you've provided us with some incredible training materials for paramedics.
Real world stuff that gets these first responders ready to handle births pretty much anywhere.
Like literally anywhere, not just in a hospital setting.
Oh, yeah, definitely. Think of it this way. These materials are like a crash course in bringing babies safely into the world in, well, sometimes very unexpected situations.
So let's dive in, shall we? Before we get into the nitty-gritty, can you break down for us exactly what makes a precipitous birth so different from a regular birth?
Okay, imagine childbirth as a journey. Right.
Okay, I'm with you.
Now, an uncomplicated birth, that's like a leisurely road trip. You enjoy the scenery, take breaks, the whole 9 yards.
Mm.
But a precipitous birth, that's more like hopping on a bullet train. Everything's happening at warp speed.
Yeah.
We're talking about the entire process of labor and delivery happening in under 3 hours.
3 hours, that's like a blink of an eye in the grand scheme of things. So, while most births happen in a hospital setting where you have time to prepare, paramedics need to be ready to jump into action at any given moment.
Right. They don't have the luxury of time. And that's exactly why this training is so critical.
It makes total sense. So let's picture this, okay? A paramedic arrives on the scene. What are the key signs, the red flags that scream, baby's coming and coming and now?
All right. So first things first, the paramedic has got to consider if the mother's given birth before.
So first-timers versus seasoned moms.
Exactly. Now, for first-time mothers, often called premips,
Premips, okay, got
you
it.
might actually see the baby's head crowning during contractions.
Yeah.
Plus, the contractions will be strong, probably 2 to 3 minutes apart.
Intense.
And of course, there's that undeniable, powerful urge to push.
Right, because your body's basically saying, it's time. Now, for moms who've done this before, those multips.
Multips, yeah. They might have strong contractions too, but maybe 5 minutes apart or even less. The urge to push will be there, and often there's something called bloody show.
Okay, bloody show. That sounds a little,
Traumatic, right?
Yeah, so what is it exactly?
Basically, it just means that the mucus plug, which had been sealing the cervix, has come out.
Oh, I see.
It's a pretty clear signal that labor is progressing.
Got it. So let's say the paramedic sees these signs, recognizes what's happening. What's their first move?
Besides grabbing their trusty medical kit, of course, the most important thing is staying calm.
Oh, I bet that's easier said than done.
You're telling me.
Hmm.
But it's all about reassuring the mother, projecting confidence, and basically creating this safe and supportive environment amidst all the chaos.
Because let's face it, this is a high-stress situation, right?
Absolutely.
Yeah.
And the paramedics' demeanor can really make all the difference for the mother's well-being.
I can only imagine. So while they're doing all of that, they're also mentally preparing for the actual delivery, right?
Exactly. They're assessing safety, making sure they can easily access the mother, and thinking about how to maintain mobility if needed.
So the scene is set. Our paramedic is prepped and ready. Now let's talk about how the baby actually makes its grand entrance. What are those mechanisms of labor?
It's like a carefully orchestrated dance, really.
Mm.
The baby first has to descend, moving down into the birth canal.
Right, making its way down.
And then it tucks its little chin to its chest. We call this flexion. It's all about finding the best, most efficient position to be born.
So the baby is like streamlining itself for the journey.
Exactly. Then comes internal rotation. This is where the back of the baby's head rotates to face the front. Think of like a key turning in a lock.
Okay, got it.
It's all about aligning with the birth canal to make a smooth exit.
Amazing how nature has this all figured out. What happens next?
Next is extension. The baby's head begins to emerge. And then finally, restitution, where the baby's head rotates to the side, aligning its shoulders with the mother's pelvis.
Oh,
And then dot expulsion.
yeah.
Baby's arrived.
Ta-da. Now, there's one thing the training really emphasized, and it's guarding the perineum. Can you explain what that is?
Sure. The perineum is that area between the vagina and the anus.
Okay, got it.
During childbirth, it stretches a lot.
Yeah.
And in a precipitous birth, it happens super fast. So guarding the perineum is all about protecting the mother from injury.
So the paramedic is basically acting as a guide, making sure everything progresses as safely as possible. What happens after the baby is born?
That brings us to the third stage of labor.
Which is?
Clamping and cutting the umbilical cord, delivering the placenta, and providing immediate postpartum care to both mom and baby.
I imagine there are specific protocols for all of that.
Absolutely. For example, the umbilical cord gets clamped and cut about 15 centimeters from the baby.
15 centimeters, okay.
Then they examine the placenta carefully to make sure it's all there. And of course, the baby needs to be dried and stimulated to encourage breathing.
Right. What about checking the baby's overall health? How do they do that?
They use something called the APG air score. It evaluates the baby's heart rate, breathing, muscle tone reflexes, and skin color.
Wow. I mean, just wow. Imagine being a paramedic in that situation. Talk about high pressure.
You said it.
Yeah.
But they're trained and prepared for these scenarios, and they really do an incredible job.
Absolutely incredible. Okay, so we've covered a lot so far. But things aren't always so straightforward, are they? I mean, what about complications? What are paramedics trained to handle if something goes wrong?
Well, one that comes to mind, though thankfully it's pretty rare, is shoulder dystocia.
Shoulder dystocia. That doesn't sound good. What is that exactly?
It's when the baby's head is delivered, but the shoulders get stuck behind the mother's pubic bone.
So the baby's literally stuck.
Yep. It's a very serious situation. It only happens in about like 0.2 to 3% of vaginal births. But obviously, paramedics need to be prepared.
Absolutely. So how would they know what's happening? What are the signs of shoulder dystocia?
There are a few telltale signs. One is called, and this might sound funny, the turtle sign.
The turtle sign. I gotta ask, what is that?
Think of a turtle poking its head out of its shell and then quickly ducking back in.
Okay, I can picture it.
It's similar with shoulder dystocia. The baby's head might come out a little and then retract back against the perineum.
Oh, wow. Okay, so if a paramedic sees that, they know there's a problem. What happens next?
First things first, stay calm. They have a two-step approach to managing shoulder dystocia.
Okay, and what's step one?
Step one is allowing a natural pause after the head is delivered.
So, in other words, let nature take its course for a moment.
You got it. In most births, there's a natural pause anyway, right? The head comes out, and then the rest of the baby is born with the next contraction. That pause doesn't increase the risk to the baby, and in many cases, it allows those shoulders to deliver naturally.
So no need to panic and start, like, pulling or anything like that.
Exactly. Now, if that pause doesn't work, they move to step two.
And step two is?
Step two involves specific maneuvers to help free the baby's shoulders. They use a handy mnemonic to remember those steps. It's ALARM.
Alarm. Okay, I'm all ears. Break it down for us.
All right, so the A stands for ask for help. Shoulder dystocia is serious business, and you need all hands on deck if possible.
Makes sense.
The L stands for lift legs. This is where the McRoberts maneuver comes in.
Ah, yes, the McRoberts maneuver.
You know it.
I've heard of it.
Great. It's where the mother's legs are lifted and flexed towards her abdomen.
Got it. Why is that so effective?
It changes the angle of the pelvis, and that often helps free the impacted shoulder. Simple, but often very effective.
Wow, the human body is amazing. What about the rest of the mnemonic?
Okay, so the next A is for adduct shoulder and applies suprapubic pressure. Basically, you gently rotate those baby shoulders and apply pressure above the mom's pubic bone to help dislodge that shoulder.
Got it.
The R is for rollover, which is the gasket maneuver. The mom is turned onto her hands and knees, which can help as well. And finally, M is for manual delivery of the posterior arm. But that's a more advanced technique and only used if the other maneuvers haven't worked.
Wow. I mean, that's a lot to remember in such a high-pressure situation. These paramedics are truly remarkable.
They are, and their training prepares them for exactly these kinds of scenarios. They know how to think on their feet and act quickly and decisively.
Okay, so we've covered a lot of ground. Let's quickly recap what we've learned so far.
We've defined precipitous birth, talked about those crucial signs of imminent delivery, and delved into the incredible mechanisms of labor.
Right.
And of course, we touched on guarding the perineum and the importance of being ready for complications like shoulder dystocia.
And of course, learned about those alarm steps that paramedics use, including that fascinating McRoberts maneuver.
Exactly.
I bet you're wondering what else can happen in a precipitous birth. What other surprises might be in store? Well, stick with us, because we're just getting started.
It really is amazing, how paramedics handle these intense situations with such skill. Like they have a sixth sense for what to do, even under pressure.
They are truly heroes, no doubt about it. So, let's say they've successfully managed the shoulder dystocia. What happens next?
Well, once the baby is delivered, the focus immediately shifts to caring for both mom and baby.
And what does that look like in a setting like this? I mean, presumably they're on the way to the hospital, right?
You got it. They're in the back of an ambulance, making sure the baby's breathing okay, checking their heart rate, keeping them warm. And for the mother, it's all about controlling any bleeding, making sure the uterus is contracting properly, all the essential postpartum checks. It's quite a feat, considering they're working in such a limited space.
It's pretty mind-boggling when you think about it. Now, we've talked a lot about the medical side of things, but I'm also curious about the emotional impact on the mother. I mean, precipitous labor's got to be overwhelming.
You're right, it can be a very intense experience, even frightening, especially if it's unexpected. There's often a sense of shock, like, whoa, that happened fast. And sometimes mothers might feel a bit of a loss of control during the process.
So how can paramedics help the mother cope with all of that emotionally while they're, in the midst of this whirlwind?
Well, a lot of it comes down to just being present and supportive, reassuring her that she did an incredible job, acknowledging how intense the experience is.
I bet clear communication is crucial too.
Absolutely. Explaining what's happening, why they're doing certain procedures, and just what to expect next. That can make a big difference in helping the mother feel more grounded, less overwhelmed.
It sounds like empathy and understanding are just as important as those technical skills.
You nailed it. Paramedics aren't just medical professionals. They're also caregivers, providing emotional support during one of life's most profound moments.
Well said. We talked about precipitous births in general, but I'm wondering, are there unique considerations for different types of births, like twins or breech presentations?
That's a great question. And yes, those situations definitely have their own set of considerations.
Okay, let's start with twins. What makes a precipitous twin birth so different?
Well, imagine everything we've already discussed, but, doubled. There's the potential for two babies arriving very quickly, so obviously there's a lot more preparation and organization involved.
So double the babies, double the challenge.
Pretty much. And with twins, there's also a higher chance of complications. One baby might be breech, or the umbilical cords could get tangled.
Okay, so a breech presentation, just to clarify, that's when the baby's feet or buttocks are positioned to be born first instead of the head. Are those more common in precipitous births?
You got it. Breech births can happen in any labor, but they are more frequent in precipitous births because there's simply less time for the baby to turn into that head-down position.
So how would a paramedic handle a precipitous breech birth? What are the key things they need to do?
The most important thing is to avoid doing anything that might speed up the delivery. Pulling on the baby's legs or trying to manually adjust a position could be dangerous.
So it's about supporting the natural course of the birth as much as possible.
Exactly. The goal is to allow the baby to deliver spontaneously, but of course be ready to manage any complications that might arise.
I'd imagine that experience and specialized training are pretty crucial in those situations.
Absolutely. Paramedics who are trained to handle precipitous breech births have this really deep understanding of the anatomy and physiology involved, which allows them to make quick, informed decisions, even under pressure.
We've talked about twins, we've talked about breech presentations. Are there any other unique scenarios paramedics might encounter?
There are. One that comes to mind is umbilical cord prolapse.
Cord prolapse. What's that?
It's when the umbilical cord slips down in front of the baby's head during labor.
Okay, and why is that a problem?
Well, the cord can get compressed, which cuts off the baby's oxygen supply.
Oh, wow. That's definitely serious.
It is. And it's more likely to happen in precipitous births because the baby descends so rapidly and that can push the cord down.
So how does a paramedic manage that in a precipitous birth? What do they do?
They have to relieve that pressure on the cord right away. That might involve gently pushing the baby's head back up into the birth canal or positioning the mother in a way that takes the pressure off.
Once again, quick thinking and knowing the right moves are essential. There seems to be a theme here.
You're catching on. It really highlights why that specialized training is so vital for paramedics.
This deep dive has been, well, fascinating is an understatement. It's like we've been given this rare glimpse into a world that most people never get to see.
It is a fascinating world, that's for sure. Full of, well, surprises, both joyous and challenging.
Speaking of surprises, what's something about precipitous births that might surprise our listeners?
One thing that people might not realize is that it can happen to anyone. It's not just limited to women who've had previous quick labors.
So it's something that all expectant mothers should be aware of.
Absolutely. Knowing the signs of labor and being prepared for the possibility that things might progress very quickly is crucial.
I think that's a valuable takeaway from our deep dive, the importance of being informed and prepared.
I couldn't agree more. Knowledge is power, especially when it comes to childbirth, which can be so, well, unpredictable.
That's for sure. Now, if our listeners want to learn more about precipitous births or about the incredible work that paramedics do, where should they go? What resources are out there?
There's a ton of great stuff online, including websites dedicated to childbirth education and organizations that support paramedics. Just a simple search will turn up a wealth of information.
Great. And before we wrap things up, what's the one thing you hope our listeners take away from this episode?
That's a tough one. But I think the most important message is this. While precipitous childbirth can be intense and sometimes scary, it's also a testament to the incredible strength and resilience of the human body.
Even amidst all the chaos and uncertainty, life finds a way.
Exactly. It's a beautiful reminder that we're all capable of incredible things, especially when faced with unexpected challenges.
Yeah, I mean, think about it. They're dealing with so much so fast.
Right, making those split-second decisions that could make all the difference. You mentioned earlier the emotional impact of these experiences on paramedics, and I wanted to circle back to that for a minute.
Oh, absolutely. That's something we really shouldn't overlook.
It's easy to get caught up in the technical aspects, the heroism, all that.
Right.
But we sometimes forget that these are real people with real feelings who are witnessing some pretty intense stuff.
You're absolutely right. And those experiences can stay with them. I mean, it's not just about dealing with the physical challenges of the situation, but the emotional ones as well. Exactly. So what kind of support is there for paramedics to help them process all of that?
Well, that's a really important point, and it's one of the reasons why support systems are so crucial for first responders. They need outlets to debrief, to talk about what they've seen, and just to process those emotions.
So it's not just about physical training, it's about mental and emotional resilience too.
Exactly. We can't expect them to just, compartmentalize and move on. These experiences can leave a mark.
Absolutely. It's something we should all be more aware of. Well, as we wrap up our deep dive into this pretty amazing world of precipitous childbirth,
Yeah.
is there anything else you want to share? Any final thoughts for our listeners?
What strikes me about all of this is the contrast. On the one hand, you have the intensity, the urgency of a precipitous birth, but then you have this incredible sense of wonder that comes with new life.
It really is a powerful juxtaposition.
Right. It makes you appreciate, I don't know, the delicate balance of nature, the resilience of the human spirit, and of course the beauty of the birthing process itself.
Beautifully said. I think you've given our listeners a lot to ponder. Hopefully, they've learned something new about what can happen during a precipitous birth, and maybe gained a deeper appreciation for the paramedics who are out there ready to handle whatever comes their way.
It was really great discussing this with you.
Likewise. And to our listeners, thanks for joining us on this deep dive. We hope you found it as fascinating as we did. Keep exploring, keep learning, and we'll catch you on the next deep dive. All right, so today we're diving into a situation that's pretty intense.
Yeah.
Just imagine being the first responder to a birth,
Right.
but there's no hospital in sight.
Oh, wow.
No doctor, no fancy equipment, just you, your know-how, and a mother about to bring a new life into the world.
That's high stakes.
It is, and that's why we're going to break down the essentials from this training guide right here to make sure you feel confident handling any childbirth scenario that comes your way.
It's definitely a unique situation, that's for sure.
It is. So let's picture ourselves arriving at the scene. What's the very first thing we need to focus on?
Well, even before we think about medical steps, we got to think about the mom,
Mhm.
right? We need to create a safe and supportive environment for her.
Okay, so making her feel comfortable.
Exactly. Find a stable surface that's clean. Make sure she has some privacy and warmth. It's all about setting the stage for a smooth delivery, you know?
Makes total sense. So how do we even know if birth is actually imminent? Are there like specific signs?
Absolutely. There are some key things to look for. One big one is whether we can see the baby's presenting part.
So what's coming out first?
Exactly. But we also need to consider, is this a first-time mom, a premips, or someone who's given birth before a multips? Their labors can be quite different.
So a first-time mom might have different signs compared to someone who's been through it before?
Exactly. With the premips, you'll often see that presenting part during and between contractions, and they'll be making strong efforts to bear down, really pushing.
Okay,
Those contractions will usually be pretty close together every 2 to 3 minutes.
got it.
Now, for multips, the contractions might be a bit more spaced out, but the urge to push and what we call the bloody show will be really strong indicators.
Interesting. Okay, so let's say we've assessed the situation and confirmed that birth is imminent. What happens next? What are the next steps?
Well, assuming it's what we call an uncomplicated childbirth.
Meaning like a typical head-down delivery.
Exactly. We need to help guide that baby through the birth canal as safely as possible.
I bet that's incredible to see.
Oh, it's amazing. The baby goes through these stages, descent, flexion, internal rotation, and then finally expulsion.
I'm guessing expulsion is the grand finale, the baby actually coming out.
You got it. But before we get there, there's this crucial stage called crowning.
Crowning.
This is when the baby's head starts to emerge, and that's where we as first responders really got to be on our game.
Yeah, I can imagine.
We got to prevent a rapid delivery, that can cause tearing.
Right?
So we'll encourage the mom to pant instead of pushing.
Panting.
Yeah. And as soon as that head is out, we got to check right away for something called a neutral cord.
A neutral cord? What's that?
It means the umbilical cord is wrapped around the baby's neck.
Oh, wow.
Yeah, it can be serious. We need to address that quickly.
Okay, so once we've ruled that out.
Then we wait for the baby's head to naturally rotate to the side, and then we can help deliver the shoulders and the rest of the body.
It sounds like a carefully choreographed dance.
It really is.
So the baby's out, we're done, right? Celebration time.
Not so fast.
Yeah.
We still have the third stage of labor.
Oh, right. The placenta.
Okay.
Okay, so walk us through that. What do we need to remember?
We're going to be watching for signs that the placenta is separating from the uterine wall.
Okay.
There'll be a gush of blood. The umbilical cord will get longer, and the uterus will feel firmer.
Okay.
Then we can gently pull on the cord to help deliver the placenta.
Makes sense.
But we don't just toss it aside.
Oh, no.
We got to inspect it carefully
Okay, why is that?
to make sure it's all there.
Oh,
Any missing pieces could cause problems for the mom later on.
that's a good point. So while we're doing that, what's happening with mom and baby?
Postpartum care is so important.
Right.
For the mom, we'll massage her uterus to help control bleeding and keep a close eye on her vital signs.
And for the baby.
Warmth stimulation and making sure they're breathing well.
So we're juggling multiple things at once here.
You got it. Caring for the mom, caring for the baby, and managing the placenta.
Yeah, that's a lot.
It is. And that brings us to something called the 10-minute rule.
The 10-minute rule.
Yeah, if birth hasn't happened within 10 minutes of our initial assessment, we need to call for help, get EMS on the way.
So sometimes even with the best prep, we need the experts.
Absolutely.
Makes sense. Now, so far we've been talking about what sounds like an ideal scenario. A full-term baby in the head-down position, progressing through labor as expected.
Right.
But what happens when things don't go according to plan?
That's where things get really interesting.
Okay, I'm intrigued.
Let's start with something that can catch even experienced responders off guard. A precipitous birth.
Precipitous birth. That sounds intense.
It can be. It's when the baby decides to make a grand entrance much faster than expected,
Okay.
usually within 3 hours of contractions
Oh,
starting.
wow. So no time to waste.
Not at all.
What are the key things to remember when we're dealing with a precipitous birth?
Positioning is crucial. We want to help the mom into a position that works with gravity, like lying down or on her side, to help control the delivery of the head. We also need to reassure her, encourage her to pant instead of pushing, and be ready to manage potential complications like postpartum bleeding, which is more common in these speedy deliveries.
I can see why that would be a lot to handle.
It is. It requires quick thinking and being able to adapt on the fly.
Right. So let's shift gears to another potential complication that needs immediate action: shoulder dystocia.
Okay.
What exactly is that?
It's when the baby's shoulders get stuck during delivery.
Oh, wow.
It can be really scary because it means the baby's in distress.
Oh.
There are a couple of key signs. We look for the turtle sign, where the baby's head emerges and then retracts slightly,
Okay.
and cyanosis, which is a bluish discoloration of the skin, meaning a lack of oxygen.
Okay, so if we see those signs, we need to act fast. What steps do we take to manage shoulder dystocia?
The guidelines recommend a series of maneuvers that you can remember with the mnemonic alarm.
Alarm.
Yeah, ALARM. Ask for help.
Oh,
Lift the legs, adduct the shoulder, roll over, and if all else fails, attempt manual delivery of the posterior arm.
That's a helpful mnemonic.
Yeah.
But I'm curious about the reasoning behind those steps. What's the underlying principle?
It's all about creating space within the pelvis to help the baby's shoulders pass through.
Okay.
Lifting the legs uses something called the McRoberts maneuver to change the angle of the pelvis.
I see.
Adducting the shoulder means applying pressure above the mother's pubic bone to try to dislodge the impacted shoulder.
Okay.
And rolling the mother onto her hands and knees, that's the gasket maneuver, can also help shift the baby's position.
So it's all about teamwork, knowing the steps, and acting decisively.
Exactly. Now let's talk about a situation that might need a slightly different approach: breech births.
Breech births. Those are the ones where the baby comes out feet or bottom first, right?
That's right.
Okay.
And the key with breech births is to let gravity do the work. We want to avoid pulling on the baby.
Right, because that can cause injury.
Exactly. Instead, we help the mom into an upright position, support the baby as it emerges, and then use a specific technique, the Morisot-Smellivet maneuver, to gently guide the head out.
That maneuver sounds pretty complex. Is it something a first responder without specialized training would be expected to perform?
It can be tricky, but the main thing is to minimize handling of the baby and let gravity do its thing.
Okay.
Pulling on the baby could cause damage to those delicate organs and bones. And we also want to avoid stimulating premature breathing.
So it's a delicate balance between supporting the birth and letting nature take its course.
You got it. And sometimes nature throws us a curveball, like an undiagnosed twin pregnancy.
Wait, so we might think we're dealing with one baby and suddenly there's another one on the way.
Exactly. It can definitely be a surprise.
Wow. Okay.
In those cases, immediate clamping of the first baby's umbilical cord is crucial, especially if the cords are connected.
Ah, I see why that's important.
Otherwise, the first baby could end up getting most of the blood supply, putting the second twin at risk.
So it's about ensuring both twins get enough blood flow.
Exactly. What else should we know about managing unexpected twin births? Well, transporting to the hospital is usually recommended unless that second baby is clearly about to be born.
Okay.
But if that second birth is imminent, we proceed with the delivery just like we would with a single birth. And remember, sometimes the placentas come out together,
Oh, wow.
so be prepared for that.
Managing twins sounds like a real balancing act.
It really is. One challenge is making sure we're adequately monitoring both babies' vital signs, especially their breathing and heart rate.
Right.
We also need to be mindful of maintaining their warmth,
Yeah.
as premature babies are particularly vulnerable to hypothermia.
Speaking of premature babies, are there any other special considerations we should keep in mind if a baby is born before 37 weeks?
Absolutely. Premature babies are incredibly fragile, even more so than full-term babies.
Right.
Gentle handling is paramount. We want to avoid any unnecessary stimulation and focus on maintaining their airway, which can be quite delicate.
And what about resuscitation? Is it different for premature babies?
It can be. Their lungs are still developing, so we need to be extremely careful with any ventilation techniques. They may also need more support with breathing in general.
So besides getting them to the hospital, what else can we do for a premature baby born outside of a hospital?
The immediate priorities are drying them off gently, keeping them warm with blankets and skin-to-skin contact, and monitoring their heart rate and breathing like a hawk.
So it's all about creating a warm and stable environment for them.
Exactly. If the baby is extremely premature, the guide recommends wrapping them in a silver emergency blanket, along with warm blankets, to help maintain their body temperature.
Oh, wow.
Now let's move on to a couple of complications that can be particularly challenging to manage in the field: malpresentation and cord prolapse.
Okay, let's start with malpresentation. What does that mean?
It means the baby isn't in that ideal head-down position for birth.
Okay.
They might be lying sideways, which we call a transverse lie, or a limb might be presenting first.
Oh, wow.
And unfortunately, babies can't be born safely in those positions.
I'm curious why a transverse lie or limb presentation makes birth impossible. Can you explain that a bit more?
It all comes down to the mechanics of the birth canal. You see, the baby needs to be in a head-down position to navigate the curves and openings of the pelvis.
Right.
A transverse lie means the baby is essentially lying horizontally, which makes it physically impossible to pass through.
Ah, I see.
And with a limb presentation, the baby's arm or leg is coming out first, which can obstruct the birth canal and prevent the head from engaging.
Okay, that makes sense. So what do we do if we encounter a malpresentation?
If it's a limb presentation, the most important thing is to not try to push the limb back in.
Okay.
We also want to discourage the mom from pushing. Instead, we'll cover the limb to keep it warm and initiate transport to the hospital immediately.
What about cord prolapse? What's that and how do we manage it?
Cord prolapse is when the umbilical cord slips down into the vagina ahead of the baby. It's a serious emergency because the cord can get compressed, cutting off the baby's oxygen supply.
Oh, that's terrifying. What steps do we need to take to relieve that pressure?
Repositioning the mom is our first priority.
Okay.
We'll either have her get on her hands and knees, that's called the knee-chest position,
Okay.
or lie on her side with her upper leg bent sharply at the hip, which is an exaggerated Sims position.
Mm-hmm.
Both of these positions can help take pressure off the cord.
But wouldn't repositioning the mother put the baby at risk of descending and compressing the cord even more?
That's a great question, and it highlights the tough calls we sometimes have to make in these situations. But the priority with cord prolapse is to relieve the pressure on that cord as quickly as possible, even if it means temporarily adjusting the baby's position.
Okay.
Once we've repositioned the mother, we'll gently elevate the presenting part of the baby to further relieve pressure on the cord.
It sounds like a delicate balance.
It definitely is. Now let's talk about another potentially life-threatening complication: postpartum hemorrhage.
We've already touched on postpartum hemorrhage, but can you remind us what it is and why it's so dangerous?
Postpartum hemorrhage is excessive bleeding after childbirth. It can happen quickly and become very serious if not managed properly.
Right.
The source material really emphasizes swift action, starting with communication resuscitation and identifying the cause of the bleeding.
Can you break down the steps a bit? What does communication look like in that situation?
Communication is about clearly and calmly explaining to the mother what's happening and what we're doing to help her.
Okay.
It's also about coordinating with any other responders who might be on scene.
Got it.
Then we start resuscitate measures like giving IV fluids and oxygen. And while those are underway, we're working to determine the cause of the bleeding using the 4 T's mnemonics.
4 T's.
Yeah. Tone, tissue, trauma, and thrombin.
So the 4 T's help us figure out why the mother is bleeding so we can take the right steps to stop it.
Exactly. Tone refers to the tone of the uterus. If it's not contracting properly after the birth, that can lead to heavy bleeding. Tissue refers to any retained placental fragments or other tissue that might be causing the bleeding. Trauma refers to any tears or lacerations in the birth canal. And thrombin refers to any clotting disorders that might be contributing to the bleeding.
It's like a checklist to guide our actions.
It is, and the source material actually provides specific instructions for managing postpartum hemorrhage, depending on whether the placenta has been delivered or not.
Okay, I can see how that would make a difference in our approach. Now, before we move on, let's quickly touch on a couple of other scenarios that need a different kind of awareness. Denied or hidden pregnancies.
Okay.
We touched on these earlier, but can you remind us what they are and why they present unique challenges?
A denied pregnancy is when a woman is unconsciously unaware of her pregnancy.
Okay.
This can happen for various reasons, psychological factors, hormonal imbalances, or even physical conditions that mask the typical signs.
So they just might not know.
Right. A hidden pregnancy, on the other hand, is when a woman knows she's pregnant but actively chooses to conceal it from others.
Okay, so very different situations.
Yes. And in both cases, They might not get prenatal care, which can be risky for both mom and baby.
So what are some red flags that might suggest a denied or hidden pregnancy?
The source material mentions a few things to watch for. First, pay attention to the patient's history and demeanor. Is she reporting symptoms that could be pregnancy-related even if she doesn't think she's pregnant?
Okay.
Is she exhibiting any unusual behaviors like denial or detachment?
Interesting. And what about physical signs?
The physical signs of pregnancy can be subtle, especially in the early stages.
Right.
You might notice a slight abdominal enlargement, breast tenderness, or changes in skin pigmentation. However, these signs can also be attributed to other conditions, so it's important to keep an open mind.
And consider all possibilities.
Exactly.
And if you suspect a denied or hidden pregnancy, how should you approach the situation?
The key is to be empathetic, non-judgmental, and respectful. These women may be experiencing a whole range of emotions, fear, shame, or confusion.
Right. It's a sensitive situation.
Absolutely. The source material also emphasizes building trust and rapport.
So taking the time to listen to her concerns and validate her feelings.
Exactly. Explain your assessment and recommendations clearly and calmly.
And I imagine that clear communication is especially important if she's exhibiting any unusual behaviors like depersonalization or dissociation.
Absolutely. Those behaviors can make communication more challenging, but it's crucial to remain patient, understanding, and supportive.
So in essence, it's all about treating these women with the same level of care and compassion as any other patient.
Exactly. Remember, the best way to care for the fetus or newborn is by caring for the pregnant patient.
That makes sense. Her health and well-being come first, and the baby's well-being follows.
Precisely.
Okay, let's take a moment to process all of that before we continue our deep dive.
Okay, so let's talk about some more complications that would need a trip to the hospital. We've already covered precipitous birth shoulder dystocia breech presentations, unexpected twins, and prematurity.
Right, those are the big ones.
But now let's dig into some conditions that might not be as obvious, but are just as important to recognize.
Okay, so the less obvious but equally crucial red flags.
Exactly. Let's start with preeclampsia.
Preeclampsia.
This is a condition where high blood pressure develops during pregnancy, usually after 20 weeks.
And why is that so concerning?
Well, it can affect multiple organ systems, and if it's not treated, it can lead to seizures, which is called eclampsia.
So what are some signs of preeclampsia that we should be aware of?
High blood pressure is the main one, but you might also see swelling, especially in the hands and face, severe headaches, vision changes, upper abdominal pain, and nausea or vomiting.
Wow, so it really affects the whole body.
It does. The guide mentions that preeclampsia can increase the risk of other complications too, like placental abruption.
Placental abruption? What's that?
It's when the placenta detaches from the uterine wall before the baby is born.
Oh, wow.
Yeah, it's a big deal because it can cause heavy bleeding and deprive the baby of oxygen and nutrients.
So if we even suspect preeclampsia, we need to get the mother to the hospital right away.
Absolutely. Early detection and treatment are crucial to prevent serious problems for both the mother and the baby.
Okay, that makes sense. Now let's go back to preterm birth for a second. We know warmth is super important for premature babies, but are there any other things we should be thinking about when we're dealing with a preterm birth outside of a hospital?
Yeah, definitely. Premature babies are super fragile,
Yeah.
even more so than full-term babies.
Right.
So gentle handling is key. We want to avoid overstimulating them and focus on maintaining their airway, which can be pretty delicate.
What about resuscitation? Is it different for premature babies?
It can be. Their lungs are still developing, so we need to be extra careful with any ventilation techniques. They might need more help with breathing in general.
So besides getting them to the hospital, what can we do for a premature baby born outside of a hospital?
The main things are drying them off gently, keeping them warm with blankets and skin-to-skin contact, and monitoring their heart rate and breathing really closely. If the baby is extremely premature, the guide recommends wrapping them in a silver emergency blanket along with warmed blankets. That'll help keep their temperature up.
So it's like creating a little warm cocoon for them.
Exactly. Now let's switch gears a bit and talk about something that might not be as dramatic as a precipitous birth or a premature delivery, but can still be a cause for concern. Lack of progress in labor.
Lack of progress in labor. So when should we start to worry?
It means labor isn't moving along as we'd expect.
Okay.
It could be because of several things like a baby that's too big or in an awkward position, a cervix that's not dilating properly, or weak contractions.
And the guide mentions that this is especially a concern for first-time moms. Why is that?
Well, first-time moms tend to have longer labors overall. So if the baby isn't moving down and there's been no change for a while, it's usually best to get them to the hospital.
Okay, so experience plays a role in how we assess labor progress.
That's interesting. Okay, let's talk about another complication mentioned in the guide, the occipito-posterior baby position, or OP for short.
Right.
Can you break that down for us? An OP baby is basically head down, but facing the mother's front instead of her back.
Okay.
And it's not the best position because the baby's head has a longer way to go to get through the birth canal.
So it can make labor harder and longer.
Exactly.
Eh.
It's often linked to back labor, which means really intense pain in the mother's lower back during contractions.
Ouch. I can imagine that's tough. And an OP position can also increase the risk of other complications, right?
Yes, it can. Sometimes the baby can get stuck in the birth canal,
Yeah.
and there's also a higher chance of tearing for the mom.
So more potential problems to deal with.
Right. So if we suspect an OP baby, do we always have to transport to the hospital? Not necessarily, but
Yeah.
a guide does recommend transport if it's a first-time mom or if delivery hasn't happened within 10 minutes of our initial assessment.
So the judgment call.
It is. We got to
Yeah.
weigh the risks and benefits and err on the side of caution.
Okay, that makes sense. Let's talk about another complication that involves bleeding. Antepartum and intrapartum hemorrhage. We've already talked about postpartum hemorrhage, but what's the difference between these three?
It's all about timing. Antepartum hemorrhage is bleeding that happens after 20 weeks of pregnancy, but before labor even starts.
Okay.
Intrapartum hemorrhage happens during labor itself.
Got it.
And postpartum hemorrhage, as we know, is after the baby is born.
And the causes for these types of bleeding can be different too, right?
Absolutely. The guide lists a bunch of possible causes for antepartum hemorrhage, including placenta previa, which is where the placenta blocks the cervix,
Okay.
and placental abruption, which we talked about earlier. Intrapartum hemorrhage can also be caused by those conditions, as well as other things like uterine rupture or cervical tears.
So basically, if we see a lot of bleeding during pregnancy or labor, it's a serious situation.
Definitely. We got to start those life-saving measures immediately and get to the hospital as fast as possible.
Okay, that's clear. Let's move on to meconium-stained amniotic fluid, MSAF for short.
Okay.
What is that and why is it a concern?
Meconium is the baby's first poop, and it's usually passed after birth. But sometimes the baby will pass meconium while still in the womb, and that can stain the amniotic fluid.
So it'll have like a greenish brown color.
Exactly. And it can be a sign that the baby's in distress, meaning they might not be getting enough oxygen.
Oh, no.
It also increases the risk of the baby inhaling meconium into their lungs, which is called meconium aspiration syndrome, or MAS.
And that can cause breathing problems.
So what do we do if we see MSF?
The guidelines have actually changed recently. Routine intubation for suctioning isn't recommended anymore.
Really?
Yeah.
Why the change?
Well, research has shown that routine suctioning doesn't really improve outcomes, and it might even be harmful in some cases. So now we focus on supportive care.
Right,
So
right.
we'll dry and stimulate the baby, keep them warm, position their airway correctly, and start positive pressure ventilation if they're not breathing well or their heart rate is low.
So it's more about observation and support than immediate intervention.
Exactly. And if the baby's vigorous, meaning they're breathing and crying, well, we can just continue with normal care. Okay, that makes sense. Let's wrap up this section by talking about non-vigorous newborns. What are the signs of a non-vigorous newborn and what should we do?
A non-vigorous newborn is basically a baby that's having a hard time transitioning to life outside the womb.
Okay.
They might not be breathing or crying, could have poor muscle tone, or their heart rate might be low.
So they're just not adapting well.
Right. And this needs immediate attention. We'll start resuscitation measures, keep them warm, and transport them to the hospital as quickly as possible.
Those steps are clear. Now, before we move on to the last part of the guide, which covers some additional considerations for childbirth in the field, let's take a quick breather and get ready for the final stretch of our deep dive. Okay, so we're back and ready for the final part of our deep dive into childbirth in the field. We've covered a lot of ground from the normal stages of labor to all those potential complications. We even touched on denied or hidden pregnancies, which can add another layer of complexity.
Right? Those situations definitely bring some unique challenges to the table, especially because the lack of prenatal care can really increase the risks for both the mother and the baby.
So as first responders, what are some things we should be particularly aware of when we suspect a denied or hidden pregnancy?
Well, the guide really emphasizes observation and a sensitive approach. We need to pay close attention to the patient's history, her demeanor, and any symptoms she's reporting, even if she doesn't believe she's pregnant.
It's like we're playing detective trying to piece together the clues.
Exactly. We also need to be mindful of the emotional aspect. You know, these women might be feeling a lot of things: fear, denial, confusion, shame. So it's super important to approach them with empathy and understanding and avoid any judgment.
So creating that safe and supportive space is really crucial. But what about the practical side of things? Is there anything different we need to do when it comes to managing the birth itself?
The basic principles of care stay the same, but we might need to be extra careful in looking for potential complications since there hasn't been any prenatal care.
Right, that makes sense. The guide also talks about the importance of clear communication.
Absolutely. It's all about explaining everything we're doing in a calm and reassuring way, using language that the patient can easily understand. Building trust and rapport is so important, especially if the patient's exhibiting any unusual behaviors like depersonalization or dissociation.
So patience and sensitivity are key here.
Definitely. Remember, the mother's well-being is directly connected to the baby's.
Okay, that brings us to another group that often faces unique challenges during childbirth, women with limited access to prenatal care. This could include women experiencing homelessness, those struggling with substance use, or women dealing with mental health challenges.
Right. These situations could be really complex. These women may have limited access to healthcare, face nutritional deficiencies, or be exposed to environmental hazards, all of which can impact the pregnancy and childbirth.
The guide actually highlights that pregnant women experiencing homelessness have a higher risk of complications.
It's a reminder of how important those social factors are when it comes to health.
Absolutely. So how do we adapt our care to meet the needs of these vulnerable populations?
I think the most important thing is to approach each patient with empathy, understanding, and a non-judgmental attitude. Building trust is crucial because these women may have experienced trauma or adversity that makes them hesitant to seek help.
So meeting them where they are physically and emotionally.
Exactly. And we also need to be proactive in checking for specific risk factors. We should ask about their history of substance use, mental health diagnoses, and any exposure to violence or abuse.
And that helps us anticipate any potential problems and tailor our care accordingly.
Precisely. And when it comes to actually managing the birth, we follow the same procedures we would for any other childbirth, but with a heightened awareness of those potential complications.
So the fundamentals stay the same, but the context requires a different level of sensitivity and awareness?
Exactly. And transporting to the hospital is generally recommended unless the birth is happening very, very quickly. The hospital can offer more advanced care and specialized resources that we might not have in the field.
That makes sense. So we've come to the end of our deep dive into childbirth in the field. We've talked about so much from the normal stages of labor to managing all those unexpected complications.
It's been quite a journey.
It has. But even with all this knowledge, we need to remember that every birth is different. We need to be flexible and ready to handle whatever comes our way.
So what are some key takeaways you want our listeners to remember?
I think the most important thing is preparedness. Familiarize yourself with those guidelines, practice your skills, and be ready to think on your feet.
The guide also really stresses the importance of communication.
Right. Clear and respectful communication with the patient, her family, and any other responders is crucial.
Absolutely. And remember, childbirth, while a natural process, can have risks. We need to stay vigilant, constantly check for any potential problems, and never hesitate to call for help when we need it.
Well said. So we've reached the end of our deep dive. Hopefully you're feeling more confident and prepared to handle childbirth in the field. But we want to leave you with one final thought. Given all the potential complications and the unique challenges of each birth, what additional resources or support systems would you want in place before assisting with a birth outside of a hospital?
That's a really good question to think about. As you continue learning, keep exploring ways to improve your skills and knowledge. The more prepared we are, the better we can help mothers and babies in those unexpected and sometimes challenging situations.
Thanks for joining us on the deep dive. Until next time, stay curious and keep learning.